Cooperation and the Senate Special Committee on the Pandemic Emergency Response. This meeting will now come to order. Good morning, everyone. Thank you for joining us. In response to the COVID-19 emergency and to protect the public, senators and Senate staff must limit the non-essential gatherings and adhere to social distancing. In compliance with those orders, we are holding our informational hearing here at the Capitol with the use of a video meeting service. Our panelists from the state and local government, the healthcare industry, and border affairs advocates and entities will be participating through the video service. In addition, to allow the public access, we have admitted members of the public to a hearing room to the extent that social distancing requirements will allow, and we'll be using a teleconference service for individuals who wish to testify on today's agenda. For anyone who will be attending remotely today, please mute your phones and computers. This will greatly aid in the eliminating of any acoustic feedback. I ask that every time you have a comment or question, you should use the raise your hand feature in the program. Each time you are acknowledged to speak, a pop-up window will appear asking if you would like to unmute. Please select unmute before you begin speaking. Our IT panel will put you back on mute when you are done. I ask that every time you have a comment or question that you please identify yourself first. For all individuals wishing to provide public comment, I will provide the participant toll-free number and access code at the appropriate time, and it is on the committee's website at this moment. When we move to public comment, a moderator will identify you individually, open your line, and at the time you may address the committee. It is important that we hear from you, and we also would like to thank you for your patience and your participation in today's hearing. I will maintain decorum during the hearing, as is customary, and any individuals who are disruptive may be removed from the remote meeting service or have their connections muted. While every effort has been made to streamline the hearing process and conduct our hearings in as close as to the same manner as is customary, there may be some lag times for participants who are adjusting to the use of new online tools or technologies. Please be respectful and patient so all interested parties can be heard. Good morning again, and thank you for attending this joint hearing of the Select Committee on California-Mexico Cooperation and the Special Committee on the Pandemic Emergency Response during these very difficult and unprecedented times. The focus of today's hearing is to discuss the impact of COVID-19 in California's border region and how different organizations and agencies are working in order to maximize our resources and further protect the border region from COVID-19. This hearing will provide an opportunity for a comprehensive and robust discussion to better understand the current status of our binational economy and its public health, and what additional policies and mechanisms are necessary to better address the needs of our border region. I look forward to hearing from the witnesses about the details of what has been occurring in California's border region, what actions the state and local public departments have taken to address the crisis from the health industry itself and the steps that they are taking, and from the border region agencies and advocates on what the next steps should be. We will also be hearing from the public to listen to your comments and concerns. I am honored to have my colleagues from the Select Committee here today, which are Senator Ben Ellen, we have Senator Stephen Bradford, Senator Melissa Hurtado, Senator Brian Jones, Senator Connie Leyva, Senator Susan Rubio, Senator Henry Stern, and Senator Scott Wilk. Thank you for your participation. We also are joined by the chair of the Select Committee on the Pandemic Response, Lena Gonzalez. Thank you for being here, and I wanted to open it up if you wanted to make some comments today and also introduce the members of your committee.
Sure. Thank you, Chair Wessel. I appreciate the invitation to jointly hold this hearing. Very important as I share the deep concern along the California's border region as well, in which I know you represent. Just to provide additional context, in California, we are currently experiencing an increase in the number of residents who are testing positive for COVID-19 along the border region. And while these increases are taking place on a statewide basis, there is some significant regional variation. One of the regions hardest hit, of course, is Imperial County, for which we are here today. And so the Senate Special Committee on Pandemic Emergency Response stands ready to support. We hope to glean some more ideas and additional issues that we can bring forward to the committee, and I thank you again for bringing us together today. And to be acknowledged are the additional committee members, our Vice Chair, Senator Pat Bates. We have Senator Andreas Borges, Senator Ana Caballero, Senator Bill Dodd, Senator Hannah Beth Jackson, Senator Brian Jones, Senator Mike McGuire, Senator Richard Pan, Senator Tom Umberg, and Senator Scott Wiener, and I thank them as well for their participation.
Thank you. I'd like to thank you and them as well, and for your commitment to this effort, and also to your commitment to establish a dialogue and exchange information on the issues that impact the state of California and Mexico during this COVID-19 pandemic. I would also like to give a warm welcome to the Consul of Mexico, Liliana Ferrer. She is the Consul General of Mexico in Sacramento. She's been an absolutely instrumental partner in facilitating important binational discussions. And of course, she's been also very close to us here in the legislature, working with us on so many issues affecting our state and our friendly state to the south, Mexico, that we're also proud to have such a great relationship. So I'd like to ask her to come to the mic and share some comments if she would. Madam Consul General, welcome. Thank you for being here.
Thank you so much, Senator Hueso. Muy buenos días. Good morning to all. Senator Ben Hueso, Chairman Select Committee on California-Mexico Cooperation, and thank you, Senator Lina Gonzalez, Chairwoman, Special Committee on Pandemic Emergency Response. Good morning, everyone. I want to give special thanks to Senator Hueso, one of Mexico's most important allies in the state of California, and Senator Gonzalez for their kind invitation to share a few words with you today. The global pandemic caused by COVID-19 has added new challenges to our strong bilateral relationship. As an example, after 10 consecutive years, one of our most important and symbolic celebrations, the Mexico-California Advocacy Day, has been postponed, and most probably it will be postponed until next year. And this is just one of many examples of important projects that the consulate has been working on with California for over a decade that we have had to postpone. But on that note, we are saying hello at a distance, but we remain very, very close at heart. However, cooperation, as I say, between Mexico and California has continued to strive. The joint hearing today at the Capitol is just living proof of this fact. As you know, California is a strategic partner for Mexico, given its common border, the size and scope of our bilateral trade, and the size of its Hispanic and Mexican populations as well. Our ties grow closer every day. It comes as no surprise that of all the U.S. states, to this date, California is the second biggest exporter of goods to Mexico, which has accounted for over 17% of California exports worldwide. And not only is California a strong economic partner, as we know, it is also a very close friend to our country and home to the largest Mexican origin community in the United States, over 12 million people. For this reason, the government of Mexico is profoundly grateful for Governor Newsom and the state legislature's support to protect the immigrant population during this health crisis, particularly those most vulnerable, many undocumented immigrants residing in California, and many of them, most of them, working in essential sectors, contributing in a very important way to the growth and development and sustainability of this economy. The Disaster Relief Assistance for Immigrants, DRAI, is a historic and unprecedented program from the government of California that has helped thousands of immigrants, many of them, as I just mentioned, essential workers. We highly value this effort, and we would like to recognize all of the work behind the bills and initiatives legislators in California are pushing to protect our frontline workers against COVID-19. Unfortunately, Mexico is also struggling, much like every other country, in the fight against the coronavirus, as we are facing one of the most complex moments, and that is why this hearing is so very timely. In this context, let us not let our guard down. Let's continue working towards the strengthening of our mutual solidarity and collaboration, and continue protecting our shared communities. Please know that you can count on the Mexican Consulate General in Sacramento in this endeavor, but also on the other 9 consulates that work in this wonderful state of California. 10 in total of 50 consulates we have in the United States. We feel most fortunate and privileged to be neighbors, friends, and family. Thank you very much.
Thank you, and thank you for your comments and all your hard work. We appreciate you here in Sacramento very, very much. Now I'd like to get to our panel. We have put together a wonderful panel today to inform members of the public and also to inform members of the committee, and the idea is that they're here to answer our questions. And today's panel, our hearing will consist of 3 panels. We will have we will begin the first panel, which is Binational Crisis, State and Local Governments Respond to COVID-19. We have with us today Jeanette Angulo. She is the Director of the Public Health Department for Imperial County. We also have Mary Salas. She's the Mayor of the City of Chula Vista, which will be joined by Steve Padilla, I believe. If not, the Mayor, I think, has it covered. But we will begin with Jeanette Angulo. If we could connect to Ms. Angulo.
Yes, good morning.
Welcome. Thank you for joining us.
Good morning, honorable members of the California State Senate. Thank you for allowing the Imperial County Public Health Department to share a few words. Imperial County, as you may know, is a chronically disadvantaged, underserved, and underfunded community. It's no secret that prior to this pandemic, the county was already in dire need for resources. COVID-19 just came along to aggravate its situation. Today, we have state and national attention. Attention we wish it was for reasons other than to discuss the grave situation our community is in. It is ironic, though, that I feel awfully grateful that such attention is being placed in this community now. There is considerable attention and concerns raised about the severity of COVID-19 in Imperial County. Of the 30,700 tests that have been administered, over 6,200 have been positive. That may not sound significant to many, but when it's a county of an estimated population of 181,000, it is substantial. Our case rate per 100,000 population is at 696 over the last 14 days, almost 3 times as much as Los Angeles, a county with a population of 10 million. In just a couple of weeks, over 500 patients have been transferred out of Imperial County into other California hospitals. Of course, a concerning situation. Like every public health department across California, we are fully committed to preserving the safety of our residents. Consequently, we have taken a very deliberate and a cautious approach in how we combat the disease. Although Imperial County has never moved further into a higher risk stage, it is taking additional and more aggressive steps to help stop the spread of COVID-19 in the community. To be clear, stay-at-home and face covering orders have been and remain in place in Imperial County. We continue to stress the importance of face coverings, social distancing, and other prevention measures. To date, Imperial County has implemented all state guidelines and health officer orders. Additionally, Imperial County has taken a very conservative approach to reopening of establishments and businesses, working closely with them so that proper safeguards are in place. At this time, dine-in restaurants, bars, personal care services, and all other higher risk workplaces remain closed. Thus, the logical question is, what is causing the surge of cases and hospitalizations in our county? To answer that, it is first important to share that Imperial County is largely invisible and forgotten as a region. Unlike more well-known and well-publicized regions such as San Diego, Los Angeles, and San Francisco, most people don't know much about our county. Imperial County is a rural community bordered by two California counties, San Diego and Riverside, Yuma, Arizona, and Mexicali, Mexico. Due to its unique location, Imperial County is a major corridor for transport to many areas of the United States. Agriculture is an important part of the county's economy, cultivating hundreds of thousands of acres of vegetables, agronomic crops, and livestock to feed the nation. Imperial County is home to Calipatria and Centinela State Prisons, Herbert Hughes Correctional Center, and El Centro Naval Air Facility. It is also home to thousands of long-term winter visitors, as well as weekend sand warriors whose passion is to ride in the dunes. To quantify some of the impact of the last aforementioned group, Imperial Sand Dunes Recreational Area, that are known as GLAMIS, supports more than 1.5 million vehicles, and the Ocotillos Wells State Vehicular Recreational Area sees over 500,000 vehicles in a year. All in all, at times doubling the population in Imperial County. Without a doubt, Imperial County is a highly mobile population. Even with international crossing restrictions, over 20,000 people are still crossing the international border from Mexicali into Calexico on a daily basis for work, healthcare, and other business. Travel is just not one way. Imperial County residents seek healthcare, shop, and visit family on the other side of the border. This last weekend, it was reported that lines to cross into Mexico were miles long with wait times of up to 7 hours. This was mainly due to screening protocols that Mexican officials had implemented for the weekend. Additionally, as neighboring counties such as San Diego, Riverside, and Yuma move through the reopening stages and modify their stay-at-home orders, travel will likely increase not only through our county, but also within theirs. It is important to note that while Imperial County has had relatively large outbreaks in congregate settings and some workplaces, most of its cases do not fall into those settings. Many of the COVID-19 positive cases are made up of individuals who are unemployed, disabled, retired, homemakers, and younger and older students. Some of the dynamics that are thought to be influencing the spread of COVID-19 are tied to culture, multi-generational families and infections within the same household, personal and social behaviors, gatherings, and the constant coming and going across the border. Within the last few weeks, Imperial County has received much needed support from its state and federal partners. Personal protective equipment, including N95, surgical masks, gowns, face shields, and other items have been supplied to many providers of this community. An alternate care site and 2 community testing sites were established. Testing kits have been supplied and a mobile lab will soon be set. Strike teams have been deployed to both local hospitals and the public health department. Additionally, a team is working on the development of an electronic public health data management system. For all that support, we are extremely grateful. However, it's a short-term fix. Imperial County is requesting longer-term sustainable solutions that are crafted with a health equity lens. it is requested that funding is prioritized to help support its public health infrastructure and its workforce, and that funding methodologies are developed keeping in mind that Imperial County has unique challenges in a daily mobile population that impacts its overall service delivery system. Thank you.
Thank you. We've been joined by Susan Finelli. She's the Chief Deputy Director of the Policy and Programs with the California Department of Public Health, and we have Eric Lamoureux, which is the Deputy Director of Response Operations from the Governor's Office of Emergency Services. And we understand they're on a time crunch, so we'd like to give them both the opportunity to present at this time. Ms. Finelli and Mr. Lamoureux, please, when you're ready there. There we go. We got the image. Please welcome and thank you for joining us. I think you guys are muted, so you'd have to unmute yourself. Okay.
Can you hear me now? Sorry.
Yes, you're
the
coming
California
through.
Department of Public Health is working with other California state departments to support and mitigate the further spread of COVID-19 on both sides of the border. CDPH is engaging with local, state, and federal officials regarding public health surveillance and notification of border and binational COVID-19 cases to protect border communities in Mexico and California. And we are engaged daily with the healthcare delivery system, primarily in Imperial, but also in San Diego, to ensure access to patient care. In particular, hospitalizations in Imperial County have required patient movement daily outside of the county. We have ongoing work with Mexico. I won't spend a lot of time. You're probably familiar with our Office of Binational Border Health. We have a long-standing collaborative relationship with Baja California Secretariat of Health, and we continue that surveillance activities with them throughout this pandemic. We also have a surveillance program called BIDS, the Border Infectious Disease Surveillance Program, so continuing to work on COVID issues with them. We are also working with CDC and other federal agencies, engaging with the federal government and Baja California to get the best case data from Mexico and identify areas where California can support Mexico. Office of Binational Border Health will continue to work with the quarantine officers on both sides of the border to make sure that we are investing in strategies to assist with border control of the disease transmission. We are also working with the federal government to push their provision of appropriate federal resources to assist with border issues, epidemiological help, and bolstering the healthcare delivery system with federal assets. More to be done on that front, however. We are continuing to work with cross-border crossings from Mexico, even though that they have limited to citizens and legal residents. This has impacted disease transmission and hospitalizations in both Imperial and San Diego counties. However, the limited resources that Jeanette just spoke about in Imperial County make that a bigger challenge for both the public health aspects of this as well as the health care delivery and infrastructure. I don't want to repeat what Jeanette has said, but with a population of 181,000 and 1 million people in Mexicali, we have about 25,000 traveling across the border every day. That has, really working in their essential workforce has put big strain on Imperial County. They're a small health department. They are working around the clock to do everything in their power to mitigate this disease, and we're trying to work as closely as we can with them, but understand ongoing challenges. They have 2 hospitals. They have 74 of their sort of 200 beds filled with COVID patients. That requires 10 to 15 people to be moved out every day. Their cases in the county continue to climb, and that we've been working with them for several weeks, working on their data management, helping with trying to get them some bilingual assets. And again, that's not an easy thing for the state either, in terms of disease investigators and contact tracers, helping with their data management system and looking at infection control in their nursing facilities, as well as outbreaks in meatpacking plants. We were able to help the county to bring CDC on site by their request to have a team of folks from CDC to help with the outbreak in the meatpacking plant primarily, but then broader general epidemiologic help. We did send a team out to Imperial County across many state agencies, including public health, both our EPI side and licensing and infection control, EMSA, Cal OES, Food and Ag, and Business and Labor on site in Imperial County on Saturday to better understand their resource needs. CDPH and the county have prioritized a number of needs. I think Jeanette talked about them as well. Bolstering the public health workforce on the EPI side and data management side, working on a data management platform, increasing testing capability on site, more work to be done there. We are working with the OptumServe sites, but we need better testing turnaround time, and really need to push the feds to give them a gene expert machine, which they sort of control. And so we are working to push that. We'll continue on infection controls in hospitals and SNFs, assistance with medical surge planning and patient transfers in their federal medical station alternate care site. Also issues with fatality management, emergency management staffing, and working on the NPIs, which we had a great call with our County Board of Supervisors earlier this week about all the steps they want to take in protecting their community and reducing the spread of transmission. So I couldn't say more about their willingness to step up a small team and really work on mitigation of this outbreak. They need resources. We're trying to get them to them as quickly as possible. On the flip side, we have San Diego County with a population of 3.2 million. Daily border crossings of 75 to 80,000, and I know they're here, so I don't want to talk too much, so I'll let them speak on their own, but a healthcare delivery system with 6,500 licensed beds, 22 hospitals, very different picture in terms of their public health and healthcare infrastructure. They have 458 hospitals last I checked, which is maybe a day old, and they have ongoing work with the Office of Binational Border Health. We are in San Diego, so a very close relationship with them and with across the border. Their county efforts have needed very little state support to date. They have a robust EPI team monitoring data to produce weekly reports showing impact in the zip codes along the border, much higher per capita rates than any other part in what they call the South Bay. Consistently 60 to 70% of hospital admissions are those that traveled to Mexico or were connected to a family member who traveled to Mexico. They also report small numbers coming from the Arizona border, but not a lot. They've been assisting in EPI and lab testing for Imperial County. They have a larger healthcare delivery system with Scripps and Sharp in South Bay. Seeing the bulk of their hospitalizations, and because those are system hospitals, they're able to move their patients within their system, within their county, and so no need for the transfers out. They report that they've taken about half of the hospital transfers from Imperial County. They were early to request the federal government provide resources and take greater responsibility and continue to push that effort. But they are also seeing a rise in their positivity rate in cases in San Diego and increasing due to community movement, as well as outbreaks in SNFs and other long-term care facilities, and outbreaks in community settings, especially restaurants and bars, food and other manufacturing companies. Many of these companies have a cross-border connection with staff living on both sides of the border, not unlike what the Imperial is seeing with workers coming back and forth and going to some of these big employers. San Diego County is working with their business community, much like Imperial, and taking action to close bars and close restaurants, effective this Wednesday at midnight is sort of their next step. And so wanting to really just share, sort of the impact of the border is great in both areas, but the ability to respond, given the resources of San Diego, is very different. So I'll stop there and let Eric add on to.
Great. Thank you, Susan. And thank you, chairs, Hueso and Gonzalez, and members. Thank you for allowing Cal OES the opportunity to speak with the committee today on the critical work underway to support Imperial and San Diego counties as they address the challenges with COVID-19 impacts within those communities. I'd also like to thank the fellow panelists Director Angulo, who recently spoke, and others for their tremendous leadership at the local and state level in response to this emergency, as well as the panelists on the upcoming session for their leadership on the front lines of the healthcare response in both communities. The role of the Governor's Office of Emergency Services is to coordinate the state's response to emergencies large and small, always in support of local government. We mobilize under the incident command structure the state personnel resources necessary to wrap around communities impacted by disasters. We also work to coordinate the rapid delivery of federal assistance and support necessary to augment those efforts. Since the last week of January, Cal OES has been responding to the consequences of the coronavirus emergency. From initially managing the response for multiple repatriation flights into California from China, supporting passengers from the Grand Princess cruise ship that docked in the Oakland port, to leading the state response since early March when the State Operations Center was activated. Our agency has been fully mobilized with staff supporting the SOC operations and field activities up and down the state. Continuously, for the past 4 months, we've led one of the longest emergency activations of the SOC in state history and are prepared to continue to guide this effort in support of local government as long as necessary. Throughout this time, our engagement along the Southern California border region, both the borders with Mexico and Arizona, has been a top priority. In both San Diego and Imperial County, we deployed senior staff within our response directorate here at Cal OES to serve as senior state officials in support of both counties. Their charge has been to ensure close coordination and collaboration of all state agencies supporting San Diego and Imperial counties, engage with our federal partners to ensure there's an effective information sharing as it relates to movement across the borders into California, and provide binational awareness of COVID-19 cases. And then finally, to oversee an expeditious deployment of personnel and resources to address requests from local government. In Imperial County, over the last 6 weeks, Cal OES has led the state of California's effort to help Imperial County manage the extensive COVID-19 outbreak. To date, as Public Health Director noted, the Emergency Medical Services Authority has transferred over 500 patients while working to add bed capacity of an 80-bed alternate care site. The state, in partnership with local health officials, is supporting the build-out of an additional 30 intensive care unit beds at the existing hospitals. We've deployed 68 California Medical Assistance Team members to be on site to support Imperial County, including work at 2 skilled nursing facilities within the county. We've deployed a National Guard mobile laboratory out of Sacramento to support the county's testing efforts. And our team on the ground in Imperial is working with local hospital officials to ensure we bring appropriate staffing levels to support the hospital needs. In coordination with the Imperial County Coroner, staff from our law enforcement branch and our Southern Region Emergency Management Office are working to enhance and stabilize mass fatality operations in Imperial County, including enhancement of staff and storage capacity. We've deployed 76 ventilators to Imperial County. We've provided personal protective equipment to Imperial County, and this has included nearly 500,000 N95 masks, more than 1.1 million surgical masks, 84,000 face shields, 130,000 gowns, more than 48,000 coveralls, 31,000 test kits, and more than 200,000 gloves. Additionally, we've sent to Imperial County 17,204 containers of hand sanitizer. Our Project Room Key program has allowed Imperial County to secure 126 motel rooms for COVID-19 positive individuals to isolate. And 10 trailers provided by the state to Imperial County are being used to house COVID-19 homeless individuals. And just this past Saturday, Cal OES led a delegation of senior officials that traveled to Imperial County to join up with our teams already on the ground to meet personally with local officials and staff to continue to work toward developing a long-term strategy to deal with the escalating situation. At both the staff and leadership level, we also continue to advocate for support from our federal partners, including air ambulance support, enhanced medical screenings at the border, and epidemiological support. Finally, and perhaps most importantly,
He just joined us.
we have approved at the state level reimbursement of all the disaster costs for Imperial County that have incurred to date, which includes their establishment of an alternate care site. All the while we've been actively supporting Imperial, we've been maintained a dedicated support cell in San Diego to address their challenges in responding to the COVID emergency. This includes serving on the San Diego COVID-19 task force, where our team provides contacts and advice on OES capabilities and state resources, including the ability of the use of the alternate care site that's been set up in the northern part of San Diego County. Cal OES has made initial requests for more public health screenings at the border and has facilitated collaboration amongst agencies and partners as we utilize our partnerships with the Federal Emergency Management Agency and the Federal Health and Human Services Agency to engage and encourage public health data and intel sharing amongst the cooperators. Through our Homeland Security Directorate, we continue to work with Corrections and Border Patrol, monitoring border passenger numbers and vehicle entry northbound into the U.S. via land and air. We've continued to work with the U.S. Coast Guard, the Centers for Disease Control, and local officials on the repatriation of cruise ship crew members that are on ships currently docked in San Diego that need to be repatriated to their countries of origin. And our International Affairs Office has been actively engaged in both Imperial and San Diego counties since our efforts began in support. Our Cal OES International Affairs Office, in coordination with the Lieutenant Governor, has been in communication with Baja California Governor's Office and Ministry of Public Health regarding COVID response and PPE needs. In May, we responded to a request through Imperial County from the Mexicali Mayor's Office to provide resources to support first responders in Mexicali, and we were successful in getting that PPE to Imperial County for those first responders. In San Diego, twice a week, our International Affairs Office participates on the San Diego Region Border Unified Command Coordination Call with San Diego County, County Public Health, City of San Diego, Border Patrol, CDC, and the National Guard, where issues on the border region are discussed and information and intelligence is shared. The sharing of information includes hospital capacity, surge information, and transports along the border. We also helped facilitate through our International Affairs Office support through our Hotels for Healthcare Worker program for healthcare workers living in Mexico that required isolation hoteling when they were off from their assignments as healthcare workers in the United States. Chairs, members, as you know full well, the emergency throughout California, and especially along our southern border with Mexico, is certainly not behind us. And as such, we're dedicated to remaining fully committed to guiding the state's response to this crisis as long as necessary. Thank you for inviting us here today, and happy to take your questions.
Thank you for that wonderful presentation, and very thorough and very complete. Appreciate that very much. It's very informative. One thing that I've been made aware of is that on the Mexico side, the government has issued a moratorium on the purchase of alcoholic beverages, which has led to a very large influx of people coming in from Mexico into the U.S. to purchase things like beer and alcohol on the border. So there's been this huge rush for these products on our side of the border. The response from Mexico has been to create checkpoints on the reentry into Mexico to make sure that people aren't hoarding these products, but it's led to lines of, I've been informed, as long as 7 hours long on Friday. So we've had cars idling in 115, 119 degree heat. But what concerns me is that this is all, I think, contributed, is my own thoughts, that it could potentially lead to an exacerbation of the COVID infection rate, especially when people are traveling and they're informing the Border Patrol or the customs officers that they're essential workers or essential travelers when they probably are not. And have you been made aware of this? Are you aware of this? Has there been a response to that? Is there any evidence that this has contributed to complicating the problems along the border of California and Mexico? I think you're muted again, so we can't hear you. He's muted. Something's going on. You're not muted on our side, so we can't hear you. Can you try it again? Nothing yet?
Chairman, can you hear
There
me
you
now?
are. You're here. You're back. Thank you.
Thank you for that. I'm not specifically aware of the provision that you said was instituted in Mexico. We can certainly follow up on that. We were aware that there's been an increase in southbound traffic as of late, traveling back into Mexico, which likely is related to screening that they may be doing as folks are headed back into Mexico. But certainly there's a number of factors with the relationship between Imperial County and Mexicali, with people living and working and having an essential need to travel back and forth. So it certainly adds complexity to the challenge down there.
Well, I would just say encourage you to look into that, because that could be a source of increased infections, and to open up a line of communication with the governor of Baja California to discuss that in particular, to see if there is any correlation with that. But thank you. If there are any members that they have to leave, so it'd be good to ask questions now. We have Dr. Pan.
Thank you, Chair, and again, want to thank chairs of both of our committees here today for bringing us together. Actually, it's quite apropos we're having this hearing today because, unfortunately, I think some states, I think New York has declared they want to essentially isolate people traveling from California to their state for 14 days when they show up. But I understand there's some discussion about that. But I think also, even when this pandemic was spreading, there's some questions about whether such efforts are really successful in trying to limit the spread of the pandemic as it spread around the world. But one of the things that is effective is actually eventually being able to move to a containment strategy in terms of not only increasing our testing, but then doing contact tracing and then isolating people who are positive with the disease. So I guess my question is about across the border that we have between California and Mexico, whether there's some discussions going on between our public health here in California and in Mexico about cooperating and doing testing, tracing, and isolation of people who are positive when we get to the point where we can manage that. And so in terms of, because knowing that people are going across the border for many different reasons, some are essential workers, some because of trade and other things, what sort of cooperative public health arrangements are being discussed in terms of being able to do testing, tracing of people to help better contain outbreaks that may be happening as people are coming back and forth across the border?
So we are in conversations with public health on both sides of the border every day. I think that the containment strategies have largely been on this side of the border. We're working with CDC to provide resources. I know San Diego has provided some testing and epidemiologic support to Mexico. And more work to be done for sure. I think the efforts have largely been on this side of the border, but in collaboration, understanding the resource needs of Mexico and working with CDC to get them more of those resources. Jeanette and others from San Diego may have more information about their relationship on the ground across the border, but ours has been through CDC and through our Office of Binational Border Health, where we're certainly having those conversations, but we're providing them some resources, but they need more, and we also are providing more resources, particularly to Imperial County, so that they can conduct the testing that they need on this side of the border.
Well, thank you so much for that response. Said this is a global pandemic, and we all definitely need to work together. It's unfortunate that the United States is not funding the World Health Organization, but we have to remember that we are part of one world, and this is a pandemic. It doesn't care about political borders, and so certainly appreciate those efforts. We need to continue to work in close partnership with our international partners, including Mexico, to be sure that we can jointly stop the spread of the disease. It's not because it's coming in from outside, it's because it's spreading around the world from within and from around. So we all need to work together. We're all in it together. So I appreciate that, and hopefully we can continue to work on building the kind of infrastructure we need to with Mexico to ensure the safety of everyone in both countries. Thank you.
We've heard from the Director of Public Health Department from Imperial County, Ms. Angulo. Now we'll go to Jim Gross from San Diego. I'm sorry, Senator Rubio, did you have comment or question?
Thank you, Mr. Chair. I want to ask a question that's really just fall under the federal government jurisdiction, but it will become a problem if we don't have answers or solutions. I understand that the federally operated Otay Mesa detention facility has identified 160 individuals who were tested positive. And I also understand that there's plans to release some of the children, or the federal government has given permission to release these children. And I think it's about 120, but what there was confusion around was if they're going to be released with their parents or individually. So I want to just know if they have answers to that. And if they're being released by themselves, is there a plan for these children? And clearly there's 160 people infected. How are we going to mitigate when these individuals come out into our borders? Because again, that's going to become our problem. Any information on that?
Your sound cut off again. I'm sorry about that. We're having some technical difficulties. Do we have everything good on the sound now? Let's try it again.
I can.
Okay, you're good.
Can you hear me?
Yes. Yes, we hear you just fine.
Okay, all right. Thank you very much for that question. I'm not specifically tracking that intelligence on that facility, but we can certainly follow up with our team that works with our federal partners on the border and find out. I don't know if our local partners might have some more information, but it's not something we're tracking, but we can certainly follow up.
Okay, well, thank you.
Now we'll move forward with Jim Gross with the County of San Diego. Mr. Gross, are you there?
I am, Mr. Chair. Thank you very much. Thank you for the invitation. I represent the County of San Diego here in Sacramento, and I've been working closely with the county on the issues that are the subject of this hearing. First of all, thank you, Mr. Chair. I think that this is a very important discussion. Not enough attention has been brought to this issue, and I want to acknowledge the comments of the Department of Public Health and OES. We are working with them very closely, literally on a daily basis. While we do feel that our resources have met the challenge, it is also the case that we know additional resources are needed throughout the border region, and particularly in Imperial County. And we are working with all of the parties to try to make sure that there are sufficient resources, data, et cetera. It was noted that we have ongoing conversations with all the parties, and we have testing sites throughout the South region. Those testing sites are free. We have focused very much on the north part of the border and immediately north of the border as an area that can be a hotspot and that is very important to deal with. As was noted, we participate with the Office of Binational Border Health, and we have a binational sector within the county that works very closely with the government of Mexico. In fact, to Dr. Pan's point, we work and are working on a bi-weekly basis through telephone calls with the health services jurisdictions in Tijuana, Tecate, and Rosarito, and have made sure that we have ongoing communication about our joint efforts and the need for resources. We also are making sure that we are able to respond to inquiries, requests for information, supplies, et cetera. We feel that that communication is working both ways, and we feel as though our efforts have increased as the problems and the infection rate has increased, and have attempted to make sure that we are keeping the public at large aware of the efforts that are going on at the border. We're conducting presentations to community groups, both in San Diego and in Mexico, to make sure that they have all the latest information, all the latest efforts that are being undertaken to prevent further spread of the disease. And as was said, the hospitals and others in the region of San Diego have assisted with the problems associated with the increase in hospitalizations in Imperial County. I think that overall, we feel as though this partnership, which has really been in existence for quite some time, was well positioned to respond to this. Our work with the federal government has also been good generally. When Dr. Alex Eastman was here in early May, we made sure that we were focused on our efforts with the federal government. And subsequent to his visit, the University of California, San Diego did make a proposal for additional testing, surveillance, et cetera. Unfortunately, the response from the federal government was that resources that had come through the CARES Act would have to suffice. We do feel additional resources are needed to focus on the border issues and to ensure that we are responding to the problems that are unique to the border region. As you know, I do not work directly in the public health department in San Diego. We expect that there are additional questions, and I will try to answer those questions, but also we'll go back to the county with any questions or need for information from you, Mr. Chair, or any of the members of the committee. Thank you.
Have you been able to identify what specific resources you need, and has there been an attempt to solicit help from any of the appropriate government agencies to help provide those resources? Is there anything that you can be more specific on? I mean, when you're talking about reducing the infection rate along the border,
again,
you
the University
mentioned
of
more resources.
California, San Diego made a specific proposal that involved additional funding. And I think that the funding support and the efforts of the State Department of Public Health and OES have been great. We do not feel that we are lacking in that regard. But I think that in order to address the problems on a long-term basis, particularly with testing and track and trace, I think additional resources are needed, and we would like to enhance that partnership with the federal government.
Well, I look forward to seeing your proposal or your report or your request for in terms of detailing what those resources are. We'd love to see what they are, to see if here we can help at the state. So thank you, Mr. Gross. Thank you for joining us.
Thank you very much.
Thank you for your presentation. We'll move on to the mayor of Chula Vista, and also Councilmember Steve Padilla. I understand you're both giving a joint presentation. Welcome. Thank you for being here today. Appreciate your participation very much in your work for the people of Chula Vista.
Well, good morning, Senator Wessel, and thank you very much for convening this really important hearing. And I'd like to thank you for having me speak today on the impacts of COVID-19 pandemic on the city of Chula Vista and the South Bay. So Chula Vista is located in South County, and it's about 4 miles from the Mexico border. And we have a population of approximately 272,000 people, which is about 8% of the total population of San Diego County. Chula Vista is the 15th largest city in the state of California, and it's the medical and commercial hub of the South County region. And it's important as the only 2 full-service hospitals within a 7-mile radius of the San Diego-Tijuana border region are in Chula Vista. So there are an additional approximately 270,000 people who are U.S. citizens or legal residents who live in Baja California and can cross the border to seek medical attention. And these increases in patients are impacting our local hospitals. Chula Vista was the first city in the county that reported COVID-19 case in early March, and we engaged with the County of San Diego immediately and sought direction and assistance. Even with a quick response, Chula Vista has experienced a much higher rate than other cities in the county, except for National City, which is our neighbor. And with only 8% of the population, we have had up to 15% of the COVID cases. And right now, as of yesterday, are 14.2% of the cases. Our efforts to reduce the spread is also difficult since we are a thriving binational region. And although we ban non-essential travel across the border, we cannot stop citizens, permanent residents, or people with work visas from crossing the border. We have been lucky that we have had emergency financial reserves to fund many efforts, but those reserves have been exhausted. With no consideration about the impact of COVID, the federal government and the state government are allocating funding based on population and not on the actual impact of the virus on individual municipalities. Our city is only getting a fraction of what it needs to help stop the pandemic and the impacts of this pandemic. A perfect example is this. The city of Stockton, which has a population of 316,410 people, has, as of June 25th, 1,455 cases and are getting a per capita of the CARES Act allocation of $85.27 per resident. Whereas the city of Chula Vista, with a population of 271,000 people, as of June 27th as well, we have 1,816 cases and only getting a per capita share of the CARES Act allocation of $12.28. So that's a huge difference, $85 versus $12. This is a stark example of how this formula is leaving cities like Chula Vista hobbled in its efforts to control the spread of the COVID-19 and leaves us heavily disadvantaged to maintain the needed services to our residents during this pandemic, and not to mention the needed mitigation of the economic impacts that this pandemic has had on our community. And while we are striving to meet these demands with the resources available, it is not enough. This virus has impacted our region, and additional resources are critical if we are to stem the spread of this in our.
I think her line was interrupted. It froze. Ms. Ellis, if you can, Mayor Ellis, if you can hear us, we lost you, and maybe we could have Councilmember Padilla maybe fill in.
Thank you very much, Mr. Chairman and Chair Gonzalez. I want to thank you for inviting me to address the committee today. The entire South San Diego County is now, in San Diego, is considered a hotspot on COVID-19 cases. South County communities in Chula Vista, National City, Bonita, San Isidro, Otay Mesa, Imperial Beach count for about 15% of the county's overall population, collectively report about 32% of our county's positive cases as of June 27. As you may know, I am a survivor of COVID-19. For 11 days, I was on a ventilator and in a medically induced coma. I lost 27 pounds and one of my lungs partially collapsed. I understand firsthand the painful impact this disease can have on our communities, particularly in vulnerable communities that are disproportionately affected. The strength, as you know, of our border region is derived from the economic and cultural interdependency that occurs with thousands of border crossings every single day. In Chula Vista, many of our residents live and work on both sides of the border. Medical tourism is an important part of the regional economy as people seek healthcare services on both sides of the border. And this movement is often mandated by the nature of frontline workers, critical service workers that reside in this part of the county that have no choice but to be physically present for work and puts them in a higher risk for exposure. The movement of people seeking quality health care in the United States and Mexico certainly presents opportunities for access. It also increases the possibility of the spread of COVID-19, as I said, in communities that have been historically affected by higher percentages of chronic conditions. Based on the 2018 California Health Interview Survey, South San Diego County region has higher occurrences of asthma, diabetes, and heart disease, and is now well known there is some correlation between other comorbidities and the risk of serious illness in connection with COVID-19. According to the County of San Diego Health and Human Services Agency, in 2017, diabetes and heart disease were leading causes of early deaths based on chronic disease in Chula Vista. As Mayor Salas indicated, we are on the front line of the COVID crisis. We are doing everything we possibly can to protect the health of our communities. However, a fair allocation of funding is needed to continue to provide services that are essential for the well-being of our residents. Any state funding should be distributed in a strategic way, not just based on population thresholds or per capita shares, but strategically directed to affect direct impacts where it is needed most. Obviously, this includes the need to reach the most vulnerable areas with the highest infection rates. Effective distribution of state funding provides an opportunity to not only protect the health of people, but to break down cultural and language barriers that have for so long stymied our most vulnerable communities. And I thank the chairs again and would certainly be happy to answer any questions.
Thank you very much, and thank you for sharing that. And you know, as the Senate representative of the border, if I could just add on to those comments, you know, it's been very complicated to advocate for my district, being that it's the only district in the state of California that borders a foreign country. And of course, the complications of that bring so many challenges to providing our adequate share of funding. This is an instance in which we see one of the largest spikes in the state with no real proportional response and resources to that problem. And so I appreciate that you made some comments relating to the CARES Act funding and how that's been applied to the state. There's some parts of the state of California that have no cases, that are seeing decreases and not increases. And while we have increases there, we don't have the funds necessary to aid in that. So we've been working very hard to make the governor's office aware of that, the Cal OES office. That's why their participation here was very important. And in past policies, like the Cal Enviro stream, completely left out the border regions and the impacts because the two measuring devices along the border were not available. So that just meant that there was no funding from that source to help communities combat poor air quality and other environmental problems. And of course, that's been exacerbated here. One thing COVID has done a really good job of showing the vulnerability of certain communities, and when we see that the border community is definitely vulnerable of many things, emergencies, health crises, environmental crises. So thank you for your participation and your comments. We're going to move on our calendar. We're going to move on to Chris Van Gorder. He's the president and CEO of Gazella. Sharif, the MD and CMO of Scripps Health. And we're going to also hear from the Pioneers Memorial Healthcare District, Larry Lewis, the CEO, and the El Centro Regional Medical Center, Dr. Adolph Edward, and from the UC San Diego School of Medicine, Jess Mandel. I guess he's the medical director there at the UC San Diego School of Medicine. Welcome. Maybe we begin with Chris Van Gorder.
Thank you, Senator. Honorable members of the Senate Select Committee on California-Mexico Cooperation and the Special Committee on Pandemic Emergency Response, my name is Chris Van Gorder, President and CEO of Scripps Health, and I'm joined today by our Chief Medical Officer, Dr. Gonzalez Sharif, and she'll assist with any questions. On behalf of Scripps Health, thank you for taking notice of the impacts of the COVID-19 pandemic in Southern California's border communities, and thank you for giving us the opportunity to share our experiences with you today. At Scripps, we take pride in our ability to respond to disasters. Scripps has responded to emergencies like Hurricane Katrina and the Paradise Fires and more. But this pandemic is different. Scripps began to see the coronavirus threat become a reality for our region back in February. In February, Scripps prepared for and treated the very early travelers from China who were quarantined at Marine Corps Air Station Miramar in San Diego. With that experience, Scripps quickly ramped up the entire system for COVID-19 response. On March 9th, we were notified by the county of our first COVID-positive patient at Scripps, the first known case in San Diego. In the beginning of the pandemic, our early cases were in North County, San Diego. We quickly opened a nurse hotline for not only Scripps patients, but for the community at large, and we stood up triage facilities at our hospitals and drive-up testing sites and at our urgent care facilities. Now, before I proceed, I want to acknowledge Governor Newsom, the legislature, and our county's swift action during these early months to mitigate the effects of the pandemic. Your actions took courage and were not without risk and criticism. But had you not taken early action, many more lives would have been lost to this pandemic. And we thank you from the healthcare providers. Thank you for your leadership. As the numbers began to grow in San Diego County, we saw a sudden shift in mid-April. On April 18th, we had 10 COVID positive patients all at once in our Chula Vista Hospital. And every day after that, the numbers continued to grow. Scripps Chula Vista Hospital is about 10 miles from the San Ysidro Port of Entry. As you know, that's the busiest land border crossing in the Western Hemisphere. In April, the San Diego Union Tribune was reporting that the cases in San Ysidro grew 111% between April 14th and April 20th. During this same time, both Scripps and Sharp hospitals in Chula Vista, the nearest hospitals serving the San Diego-Tijuana border, experienced averages of upwards of 18% positive COVID-19 test results, compared to an average of 6% positive results elsewhere in the county. Over the weeks to follow, that number became even more pronounced. Our hospitals in Chula Vista saw spikes exceeding 25% positives, while the county percentages of positives more broadly dropped below 5%. By the end of April, 80% of our COVID patients were at our two Scripps Mercy hospitals. Further, 48% of COVID positive patients who visited our Chula Vista emergency room between May 24th and May 30th said they had recently traveled to Mexico. That figure jumped to 60% between May 31st and June 2nd. Only about 5% of COVID-19 patients reported that they'd recently been to Mexico at Scripps' other three emergency departments. Now, we're fortunate. Scripps and Sharp are both systems with multiple hospitals, and so while our Chula Vista hospitals were at near capacity for weeks on end, we had the luxury of being able to transfer some of those patients to our hospitals in the northern part of the county. On May 11th, Scripps had 6 patients arrive at Scripps Mercy Chula Vista directly from the border within an hour, 4 by ambulance and 2 walk-ins. 2 of those patients were back-to-back intubations as they were critically ill when they arrived. This experience is not unique to Scripps. This trend continues today. Just last week, we received 7 ambulances from the border to our Chula Vista Hospital. By this time in mid-May, we had transferred 43 patients from Scripps Southern hospitals to our northern hospitals to make room in the south. Today, that number is more than 157. I think as of this morning, it was 157 patients we transferred from the south. We saw a slight stabilization at the end of May and the beginning of June. However, since June 19th, our numbers of COVID-positive test results have not only gone back up, the numbers are doubling. On June 22nd, we had 43 unique new COVID-positive cases system-wide, the highest since the start of this pandemic. New records were set the following 2 consecutive days. Our daily average is now well above the previous daily case records set at the previous peak way back in March. On June 23rd, we had 48 unique new COVID-positive cases system-wide, the highest since the start of the pandemic. Our nurse hotline is seeing an average of 1,600 calls per week, up from it started about this 1,000. At Scripps alone, this poses a challenge in our staffing, our supplies and personal protective equipment, and so much more. As we fight the COVID-19 virus, Scripps is using 10,000 surgical masks, 1,000 N95 masks, 6,000 isolation gowns, and 160,000 gloves every day. The need is great. The challenges in our border communities are complex, given the integrated nature of our families, our communities, and our economy. We are not a San Diego community of 3 million people. We are a community of 3 million people in San Diego, plus hundreds of thousands of US citizens, dual citizens, and Mexican nationals with the needs and rights to cross the border. San Diego hospitals are also a lifeline to support the healthcare needs of Imperial Valley and have accepted a tremendous amount of transfers during this difficult time. As of this morning, we had accepted 231 patient transfers from Imperial County, 183 from Pioneers, and 48 from El Centro Regional Medical Center, and 81 of those patients were COVID positive. So we don't need a border closure. We need support. We need supplies, PPE, medication, reagents for our labs, and FDA-approved swabs for both COVID-19 and influenza, all of which are in deep and short supply. And we need creative solutions to protect the communities of both sides of the border. We appreciate your leadership. We appreciate your time. Thank you for letting me present.
Thank you very much. Now we have Larry Lewis, the CEO of Pioneers Memorial Healthcare District.
Good morning, committee members, and thank you for offering this opportunity to speak about Pioneers' experience during the COVID emergency. Pioneers is located about 2 hours east of San Diego and about 25 miles north of the Mexicali border. 107 beds, so we're a rural hospital, 120 million in net revenue, and about 800 employees. Like everyone's experience, we saw this as a faraway storm at first with national news. It was like tracking a hurricane. Reports were first heard near the first of the year. Certainly the reports from Washington and New York City painted some enhanced views of the possible COVID storm hitting this nation. California Hospital Association and Emergency Operations Center alarms went off shortly thereafter. In early March, CHA Executive Board of Directors sent an urgent alarm requesting hospitals to develop a flex plan for a COVID patient storm surge. In preparing for that storm, Pioneers established an incident command system in early March, and we began by creating space, ICU space, moving up from 8 licensed beds to up to 13 quickly, and eventually up to 32 beds just in space plans. Negative airspace, starting at 29 to move quickly to 40, and today we're at 58 negative airspace beds. So total bed capacity really was planned to increase, especially with the possibility or contingencies of exterior tents and shelters set up. We had closed elective surgeries, and the shelter-in resulted in a 40% immediate drop in our revenues. Clinics were cut in half, emergency rooms, surgeries all decreased dramatically overnight with the shelter-in order. Also created a cash crunch and resulted in some layoffs early on, not knowing what to really expect is going to happen and no indication of what kind of relief would be organized. But the storm surge did increase, and certainly El Centro, which you're going to hear from next, had a continually much higher number of admissions than Pioneers. But at Pioneers in March, our first case was on March 16th. We had 9 new admissions in March. In April, 21 new admissions, likely fueled, we anticipate by or expect by Easter escalation. And we had no cases transferred from Pioneers that were COVID patients that month. In May, we proceeded to see 62 new admissions, also fueled by Mother's Day and Memorial Day is what we assume as we correlate days with the increases. And we transferred 28 cases that month alone. Early June, we were on a pace in the first 9 days for about 60 new cases. I don't have a total number right now, but I'm sure it's in the 70s and beyond. In addition to that, we transferred 76 cases through June 28th. So that's a dramatic increase. What you see in the way of census is only the beginning of the story from the area. And we're right now anticipating a strong possibility that the 4th of July could result in even greater contact and spread of the disease. So we're planning on this level to continue for the next year. We've gone away from a short-term strategy and how do we work through this crisis to this is our new way of operating. The financial pressures are great. We did see some CARES Act funding, which greatly helped us as well, most recently in June. But it's really without any notification of what to expect or how much to expect or what's coming next, if anything. So while we're in a good position today, there's still going to be great needs. Resource shortages, as Chris mentioned, the PPEs, immediately nothing was available and you couldn't increase supplies at all. But we do thank our EOC partners in the county who have been very responsive on that. Testing as well, real time, we had no testing and then some testing and now more testing, but now we have, let's say, sporadic interruptions that cause us to shut down for a day or two or three at a time. Equipment acquisitions, ventilators primarily. The state was very quick to react, as was our county EOC, to provide us some transport ventilators, but they're not intended really for long-term use. Emergency operations support has been great. As I mentioned, the PPEs that they provided and their quick responsiveness, they're greatly appreciated. I think that the organization of emergency response has been much greater than I ever expected. The transfer center has been very prompt and Dave Duncan has been very responsive. National Guard that they provided was much needed and just in time. As far as suggestions go, excuse me, we look to see that in the future we can continue to coordinate our meetings and our emails and start to plan more on, it's easy to add new space, it's more difficult to add staff. And as we're prioritizing needs, I do see that the EOC is really strongly supporting us more in staff needs, which is what we really need because there is existing space. It just needs staffing to be able to create that. We should stand up the facilities first, and that comes with staffing. As far as a short-term future of change, defining the change is difficult. What we see is the volumes continue to increase, the transfers continue to increase, and there's no imminent vaccine or cure identified in the next 6 to 12 months. So it's about planning for the change. And as I mentioned before, now it's not about dealing with a crisis. This is an ongoing way of life now, at least for the next 12 months. So resources that we need, I look first to, there are more plentiful supplies available, but I'll call it or equate it to food insecurity. It's supply insecurity. We don't know when the next shipments will be or how big those orders are going to come in, how well they're supplied or whether they've cut back on them. But we have seen great increases, and that's been very helpful. There's urgent need for treatment resources. Our rapid testing orders are not reliable. We run short regularly. I did hear from the National Guard this morning, which I was great to hear. I think on Saturday, they were in on the state's visit to the county and heard about the periodic shortage of the supplies for our BioFire. This morning they called and said that they expect to be down here shortly with BioFire and supplies and staff to run it. So that logistics is being worked out right now. Remdesivir, the state-of-the-art pharmaceutical treatment regimen, is also a shortage out there. There have been significant increases, and I did hear that we were due any day now to receive the next shipment. But again, we're getting back to, there's been great improvements, and now it's about the insecurity. Are we going to be able to keep that up, and will it keep growing in need out there? Registry, we've tapped into 20 critical care nurses, 10 of which we expect to see by Monday. One additional intensivist to help relieve the only other critical care physician in the valley. 4 RTs and 10 more med-surgical nurses out there. But the need is really going to be how to support that at a registry premium cost. So there is going to be a need for increased funding in the future. real-time needs, continued support for safe expansion and alternatively licensed space. We appreciate that the state and CDPH have all been very helpful in allowing us to quickly transition space, like an ultrasound space, into ICU beds, and moving our ultrasound and our PT space. Transitions from immediate ER need space to permanently available space is going to be needed. That is there today, but we're going to need to continue that. And then the long-term future is just yet to be defined. I think the shelter-in impact has a great unknown out there about how that's going to change society on the long term. Social distancing and PPEs, the fear of the virus impact on travel and hospitals as a place to heal, as opposed to a place to avoid because of the virus. All of those are going to have great long-term impacts. Primary care in rural areas is always needed. I think the final, or the conclusion here, I want to make sure that I'm repeating kind of what Chris had said. Social distancing doesn't appear to be working. It is needed, but as you correlate the holidays with the increases in transfers out of here and the increasing census, it's hard to tell how we're going to be able to change the social norm. Maybe by communicating through testimonials of those in the community that know and are known and trusted. In any case, I think there needs to be a change for a longer term solution.
I just wanted to ask you, there was a, I'm sorry to interrupt you, I thought you were finished, but I wanted to ask you, there was, of course, a disaster up in Niland. You're the hospital closest to Niland. Over 40 homes were burned, families were displaced, and of course they're being held in temporary facilities right now, and I hope their health is being protected through this crisis that they're enduring. But I wanted to ask, did that affect the operations of your hospital? Did you see any admissions to your hospital related to that complicated things?
I did not hear about that specifically, so I would only say that we were immediately made aware, and our organization, our staff have all begun to accumulate resources that are needed out there. There's a great response going on, including the Pioneers family here.
Have you been at all in communication with, or in partnership or in cooperation with the Office of Binational Border Health in Imperial Valley? Has that been if you know, the state of California has an Office of Binational Border Health that coordinates between Mexico and California on health matters. Are you engaged with that? Are you aware of it? Is that something that you have been using as a source of potential resources?
I do learn from them. I'm not a regular participant in their meetings, but I do participate and respond when asked. So I do think it's a good resource to be able to communicate across borders and learn how we can help each other. But I don't have any other active participation in that.
Do you feel that there's been an outreach by the office to help you during this crisis?
I did not hear from them directly, no.
Okay, thank you. We're going to move on to Dr. Adolph Edward with El Centro's Regional Medical Center. Doctor, are you here?
Good morning, committee members. Thank you for taking the time to listen to our input and for all that you will do to assist Imperial County to fight back against this coronavirus pandemic. Your help and support is requested, needed, and appreciated. I especially want to thank Senator Ben Wesso, who has been a strong supporter of ECRMC throughout his career. I'm the CEO of ECRMC, and since 2016, UC San Diego Health has managed ECRMC. Our chief medical officer, our entire medical team in the ED, and I are all UC San Diego Health employees and hence state assets. On the 18th of February, ECRMC stood up its Operations Command Center. We put our entire team on high alert. I thank the medical service and the Air Force for my 22.5-year service for allowing me to learn about that. On or about 8 March, I announced to the residents of Imperial Valley the arrival of our first COVID-19 case. The family members had traveled to see their kids in Mexico and Florida, and they were returning through Atlanta, Georgia. One family member has since passed away. This is one of the many stories that have become the new normal since that day. The impact of COVID to those who have lost their family members is devastating and no doubt has changed their lives forever. We have seen a nonstop increase in cases at ECRMC since that day, including an increase in the number of cases coming from Mexico. Across the border, 275,000 U.S. citizens who live in Mexicali include 30,000 retired U.S. military veterans like myself and thousands of green card holders across the border. But also remember, there are 60 members of my staff that work here out of the 1,100 live in Mexicali, and they are essential employees and they do travel back and forth. Many of these folks that travel to El Centro and our hospital to seek care. ECRMC does not ask patients about their national origin, their ethnicity, sex, or even health insurance coverage, and so we render the care to many. Beside the 500 patients that you've heard that have been transferred since, ECRMC has had served over 2,000 patients since our first cases in March. Daily, we see 100 to 125 or more patients that come through our ED. And one day in May, we had 65 plus COVID patients in the hospital that had 110 patients. That's 60% of our patients were COVID positive. Initially, we used to transfer 2 to 3 patients each day for care we could not provide. But now we're transferring 5 to 10 patients daily due to the excessive COVID care needed that we cannot keep adding to our limited capacity facility, which is constrained by both size and staffing limits, as you've heard from Larry. We have seen an increase in the number of cases as well from our own community members who travel to Yuma, Arizona, and other locations in the vicinity that have been open. These members return back to Imperial Valley and come to the with COVID symptoms. ECRMC lost $2 million in the first month dealing with COVID in February and had lost $4 million each month since then. The Federal CARES Act funds have dried up fast. Additionally, hospitals like ours will be receiving additional remdesivir allocations. Under the agreement, ECRMC has been using the drug and with encouraging results, but will now have to pay the wholesale acquisition price for the drug, which is about $3,200 per treatment course, which AmerisourceBergen likely to ship for us every 2 weeks. The problem is this adds $500,000 of expenses to our bottom line, which we do not have, and we will need help covering those costs. We have received plenty of help from the state of California. We've had 2 disaster medical assistant teams mobilize and help us with staffing. We also had the California Department of Public Health mobilize at least 8 young newly minted RNs to help us. We've had the Air Force Reserves send us a team of clinical therapists and doctors. We have learned that they will stay with us until the 15th of July, 2020, and we cannot thank the Air National Guard for that extension. We cannot thank the Emergency Medical Response System and OES headed by Dr. Dave Duncan for all the help that he's provided us. He, as well as our county heroes of EMS team, have arranged for full air, ground, and emergency requests to offload patients into other facilities and other counties when we needed it the most. If he had not done so, I assure you, we would have been overwhelmed. We also have shared our needs with many high-ranking state officials, including a recent visit by Dr. Sonia Angel, the state public health officer and the director of CDPH. We informed her that the design and the delivery of the federal alternate care site in Imperial County was lacking the right support to fight COVID. We need the 80 beds that you have heard about to actually be able to receive higher levels of care so that we decant our ICUs so we can continue on to include more patients as they come through our ED. For that reason, we're asking for you to support their strategies to help us by staffing and manning so that we can stop the reliance of transferring patients out of the county. As hospitals in San Diego County and across Southern California begin to fill up with COVID patients, our patients stay with us in the ED waiting to be transferred, sometimes in excess of 3 days, and this is not acceptable. We receive many reasons for the delays of being transferred, some of it related to even patient insurance status. We've asked the California Hospital Association for help, and they have since helped us. We need to stop our reliance on transferring to UCSD and other locations. We need to actually establish patient care in the Valley and increase that care. Our first ask is the state of California continue to understand that it's not easy to have all the resources needed to make critical care and ICU care readily available. It is expensive and provided through companies that are charging large amounts of money to share the assets with us. The critical care needed include intensivists and other resources. If you are asking me today, what do I need to expand my ICU capability? The need is simple: 4 ICU doctors, 28 RNs, 14 respiratory therapists, and 20 additional vents, in addition to all the vents we have received through the county response team and through the state. We have relied on support from UCSD for our intensivists and have advanced the delivery model in our ICUs because of that partnership. We continue to get the support we need, but UCSD too may see a surge that will task them, and hence our need to ask for this kind of manpower support from the state of California to help deliver care near home. With close to 30% of unemployment rate and with 43% of our patients on Medicaid, we will continue to need help caring for our community beyond today. We are thankful for all the help the state of California has provided us so far. However, Imperial County needs the state's help to stop our reliance on a transfer system that may be non-existent in the next few months if COVID patients increase across the state. We need more state support to staff us or support us financially so we can afford to do so ourselves. We have been spending over $1.5 million a month on extra help and resources through staffing agencies. This is not anything new. We're going to need more for the coming months. Our second ask is that we do not forget ECRMC and other hospitals in the reliance on disproportionate share hospital dollars, 340B program, and the state prime program, and more state funding streams just to make ends meet. Please discourage any cuts in these programs for both hospitals. We are passionate about our valley and our community. I thank you for your time and thank you for your support of Imperial County and ECRMC. This hearing shows your commitment and support for our healthcare mission. That concludes my remark, and I can answer any questions.
Thank you, and I appreciate very much that you came up with a very specific list of your needs, and that makes it easier for us to work on satisfying your request. I appreciate that very much, and everyone else that's on this call and on this panel that have participated. I look forward to working with you to try to bridge that gap to funding or providing those needs to those areas that need them. So anything you can do to forward a specific list to our office and to the governor's office so we can work diligently to support your efforts in making sure that the people of our state are cared for. We're going to move on to Jess Mandel. He's the medical director at UC San Diego School of Medicine. Doctor, welcome. Thank you for joining us. We really appreciate having you join us today.
Thank you very much. Chair Hueso and Chair Gonzalez, thank you for inviting me here to testify today. I especially want to thank Senator Hueso for raising awareness about the COVID-19 situation on the border. I also want to thank him for his strong support of UC San Diego and UC San Diego Health over the years and his strong commitment to serving the San Diego region. Approximately 2 months ago, physicians in San Diego became concerned about the worsening COVID-19 epidemic in Tijuana. With assistance from the San Diego County Department of Health, we were able to make contact with Dr. Reyes Escamilla, the director of Tijuana General Hospital, and arrange a visit in early May by San Diego physicians and nurses. The situation was very sobering, as there were both an overwhelming number of COVID-19 patients and a decreased number of physicians and nurses, since many had contracted COVID-19 and were required to quarantine at home. Additionally, all Mexicans over the age of 60 are not allowed to work because the Mexican government has deemed it too hazardous to their health. Many healthcare workers in Mexico are over the age of 60, so this further compounded the problem. We and our Mexican colleagues decided that we could best assist by starting daily visits of San Diego physicians and nurses to Tijuana General 7 days per week for 4 weeks in order to round in person on the most critically ill and the most challenging patients with respiratory failure due to COVID-19. San Diego County Medical Society and my colleague, Dr. Andres Smith at Sharp Chula Vista, assisted in recruitment and support between May 18th and June 14th. During that period, we made 28 consecutive daily visits that included 8 critical care physicians, 2 infectious disease physicians, 4 respiratory therapists, 29 critical care nurses, and 4 translators, as well as extensive administrative coordination provided by UC San Diego. Based on the experiences of these team members, we presented the hospital director at Tijuana General with detailed suggestions for improvements in care in multiple areas, and these were received with enthusiasm. We are now seeing significant improvement in processes of care in Tijuana and believe that we are seeing improvements in patient outcomes as well. At the same time that we were doing this, we also raised almost $40,000 to purchase equipment for Tijuana General Hospital. We purchased desperately needed bedside monitoring equipment for mechanically ventilated patients and have also purchased humidification equipment for their ventilators, which are essential for safely mechanically ventilating patients with COVID-19 who may require this therapy for several weeks. Following completion of the daily in-person support at Tijuana General, we've continued the collaboration via teleconsultation from San Diego on some of their most difficult ventilated patients 2 to 3 times per week. Because of our successful collaboration with Tijuana General, about 3 weeks ago, we received an invitation for our group to visit Mexicali General Hospital and to try to assist there as well. We visited there on June 11th, and overall, we were impressed with the magnitude of the challenge that they're facing, as well as how well they're trying to handle it. Working with the hospital director, Dr. Ovalle, we've started telemedicine collaboration with them as well and plan additional inpatient visits, including one tomorrow, to focus on specific initiatives related to prone ventilation, pressure ulcer prevention, and other interventions to improve patient outcomes. With both Tijuana and Mexicali, we will be inviting physicians and nurses from the hospitals there to visit UCSD and join us in rounding on COVID-19 patients, as well as inviting physicians there to join our teaching conferences each week via Zoom. It may be possible to combine some of the visits to San Diego and some of the telemedicine initiatives between both Tijuana and Mexicali in the hope of strengthening collaboration and crosstalk between these 2 important Baja California hospitals, and including other hospitals in Tijuana as well. I should note that in addition to assisting Tijuana and Mexicali, UC San Diego has been working to support California hospitals near the border who are impacted by this public health crisis. We've been supporting both the ICU and the emergency department at El Centro Regional Medical Center with physician boots on the ground who directly provide care, and also with telemedicine support to El Centro from San Diego. Our mobile ECMO team has gone to El Centro and to Chula Vista to stabilize the sickest of the sick and transport them back to UC San Diego for further care. In conclusion, we're proud to support our colleagues in Mexico during the unprecedented challenges of the COVID-19 pandemic. The Mexican physicians and nurses with whom we collaborate are extremely dedicated, smart, and hardworking on behalf of their patients, and we have learned a great deal from their experiences and perspectives. Truly, these efforts have helped patients on both sides of the border, and we hope to continue these collaborations far into the future. Thank you for the opportunity to speak with all of you today and for all you're doing.
Thank you, Doctor, and I think I speak for the entire legislature, for everyone, every single person in the healthcare industry providing that front line of support, all the directors, all the doctors, all the nurses, all the support staff, all the emergency response staff, everyone that's helping with this crisis. From the bottom of our hearts, we're very grateful to you for all your work and your dedication for the people of California. So thank you for joining us today. And again, we're doing our best here to provide the resources necessary for the people of our state. So please, we invite you to continue to communicate with us and ask how we can support you more. Thank you for joining us. We're going to move on to our next panel regarding vulnerable populations. We all know how this pandemic has exposed our ability to cover everyone equitably across the state, and there are vulnerable populations that have seen a disproportionate impact of COVID, not only in the health arena, but also in the economic fronts. The economic and public health impacts of COVID-19 will be shared with us by the Mayor of Imperial Beach, Serge Dedina. He's also the chair of the Sandag Borders Committee, and he's uniquely aware of the impacts of COVID along the border, being that he represents the southernmost state in the state of California. We also have Kate Clark. She's a senior director of immigration services for the Jewish Family Services Center. And we also have Luis Olmedo, the executive director of Comité Cívico del Valle out there in Imperial County, doing a wonderful job at providing support for the vulnerable populations and fighting for air quality, jobs, and so many other things. We're very, very honored to have Luis Olmedo with us today. We're going to begin with Mayor Serge Dedina. Welcome, Mayor, Mr. Chairman. Thank you for joining us today.
Thank you so much, Senator Hueso. I just wanted to thank and say good morning to Senator Hueso, Senator Gonzalez, and Consul General Ferrer, and echo your acknowledgement, Senator Hueso, of the moving testimony of our medical workers and leaders from Imperial and San Diego County, and acknowledge the absolutely heroic and courageous and inspiring work that they've been carrying out. We do appreciate it greatly. I'm the mayor of the city of Imperial Beach, the southernmost town on the California coast, a true border city, and the chair of the SANDAG Borders Committee. SANDAG, the San Diego Association of Governments, is the regional council of governments and the metropolitan planning organization for the San Diego region, also serving as its regional transportation planning agency. SANDAG is the only government agency, regional government agency, in the United States that includes Mexico as an advisory member on our governing body, the Board of Directors. And we have a Borders Committee, which provides oversight for planning activities that impact the borders of the San Diego region, our county borders, our tribal borders, as well as, of course, our border with Mexico, and a Committee on Binational Regional Opportunities, a binational working group of elected officials and stakeholders from academia, the business community, and civil society on both sides of the border that addresses our binational challenges. Last Friday, we met and even heard from Caltrans on its advanced planning for binational infrastructure projects, which is most needed in California. I don't really need to say that San Diego, like the rest of the country, has obviously been impacted, as well as Mexico, during these extraordinary times due to the COVID pandemic and health crisis, but obviously as part of our nation's continuous struggles with racial equality, social injustice, and fairness, which have been exacerbated in the issue of inequality and social justice, and how this pandemic has played out both economically and in terms of who's getting sick. Our border with Mexico has remained open this time, as you've heard, operating with some restrictions and allowing U.S. citizens to return to their country, while also permitting essential workers who serve our communities to keep shared production lines operating. You know, the economic and social integration of San Diego with our neighbors to the south is so advanced that many of the economic and social inequities laid bare by the pandemic can best be understood through a binational lens. And for example, I think as we've heard, many San Diego service sector jobs considered as essential medical jobs are held by people who live in Tijuana. And we've heard about the thousands of American residents from Northern Baja who've crossed the border to get medical assistance during this pandemic. COVID-19 has impacted all our communities, but a recent report by SANDAG highlights some really impactful, critically, and frankly, devastating research on COVID-19 and its disastrous impact on the communities most exposed to the economic and health impacts of the pandemic. And we'll go to the first slide, please, or the second slide. So the map on the left of the slide shows the areas in the San Diego region that were hit hardest by unemployment. The map on the right shows the areas that have the highest rates of COVID. And the purple lines outline the census tracts designated as disadvantaged communities by the state CalEnviro Screen tool. So intuitively, you can see that just by looking at the colors on these two maps, that the areas that experience the highest unemployment are also the areas that are hardest hit by COVID, where you see the intersection of public health as well as economic inequity. Not saying there is necessarily a causality, meaning one caused the other, but there's definitely a correlation. The next step of the SANDAG analysis was to identify the zip codes that had both the highest cases of unemployment and COVID. And here's what you can see what that means for our border region. There are 17 zip codes in San Diego County that are in the top 25% for highest levels of unemployment and COVID. What we can tell from the data is that the pandemic in San Diego hit hardest for those who worked in industries that were shut down, like tourism, retail, and hospitality, mainstays of the San Diego economy, but that those that were working while most of us were sheltered in place, and those that couldn't stay at home. So, you know, what we see was that these first responders, doctors, nurses, and the new essential workers are the fuel of economic activities, including the North American supply and production lines that are operating. what the next slide. So what this research shows us is that Black and Hispanic populations are overrepresented in these high contact essential industries. That means they are either at higher risk of losing their jobs or at higher risk of exposure because the job they have is essential and continue to work despite high public health risk. For example, Hispanic employees account for 32% of the overall workforce in the region, but represent 46% of those working in the food service industry. By the same token, Hispanic employees make up the largest percentage of the essential workforce in building, cleaning services, 65%, grocery and drug stores, 44%, and childcare and social services, 39%. Similarly, Black employees account for nearly 5% of the overall workforce in the region, but represent a larger percentage of the essential workforce. More than 7% of the childcare and social services, 9% in trucking, warehouse and postal service, and nearly 20% of public transit workers. Next slide. According to the Sandag study, when compared to the white population, Hispanic and Black populations are more than 4 times as likely to live in areas that have been impacted by both unemployment and COVID-19. More than 2/3 of the region's Black population, 70%, and Hispanic, 67%, reside in zip codes with higher than average unemployment rates. And approximately half of Black, 52%, and Hispanic, 49% residents live in zip codes with higher than average COVID-19 cases. While these statements likely do not surprise many participating in today's hearing, we now have the data points to back them up. And this is the kind of research that needs to lead to systemic policy change. And what do I mean by that? It means that change, investment in infrastructure, housing, public health, addressing this crisis that directly deal with the issues of inequality and fairness and social justice. And it is critical that the border region consider special strategies that address these issues of equality and social equity when dealing with situations as the pandemic. And what we've seen during this crisis is we don't have to spend years and years of debate and meetings to get things done. We can move, and we must continue to move at lightning speed to get things done, to make investments that matter, to carry out programs and activities that matter, because excuses about what we can't do and why we can't do things no longer apply. And I think we saw that from our colleagues in the medical field from Imperials, who did us a service by moving at lightning speed when they were needed the most. In a broader perspective, we have seen all facets of daily life impacted by the pandemic, and the U.S.-Mexico border is no exception. And just to highlight something, in addition to this pandemic, we've suffered a crisis of border pollution, toxic sewage, and toxic waste. Since November, the residents of South San Diego and Imperial Beach most impacted by COVID and unemployment have also been exposed to more than between anywhere from 25 to 75 million gallons a day of raw sewage in the Tijuana River that it enters the United States for the last 7 months. This situation is worsening, and we needed access to our beaches and healthy open space. Our beaches have been closed pretty much for that time. Restrictions for non-essential cross-border trips went into effect on March 21st, 2020, and were extended to at least July 21st, 2020. Since then, we've seen northbound pedestrian crossings decrease by 75%, what we typically see, and vehicle crossings fell by half, and truck crossings fell by about 25%. That said, tomorrow on July 1st, our 3 North American countries will start implementing the new free trade agreement like the USMCA, which thanks to our congressional delegation, senators like Senator Hueso and our Senators Harris and Feinstein included $300 million to address transboundary sewage issues. So we're grateful for that. And so this is a historic moment. One that represents an opportunity for the reactivation of our economies and our border region that is strategically positioned to take advantage of. And the USMCA has kept up hopes that our binational economy and critical production lines will have the policy environment and market assurances to keep thriving. From Sandag's perspective, we have a huge opportunity to apply the lessons learned from the impacts of COVID-19 as we developed our next regional transportation plan, San Diego Forward, the 2021 regional plan that will be our vision for the region over the next 30 years. And our focus on collaboration across jurisdictions and international boundaries will help to leverage the region's strategic location within the growing mega region. Infrastructure in the border region is critical to both Mexico and the United States. SANDAG coordinates several comprehensive planning efforts to improve U.S.-Mexico border transportation and infrastructure. But other cross-border efforts include working together to improve water quality, as I mentioned, and supply, develop and expand energy resources, and protect marine and terrestrial habitats. Innovative leadership among government agencies and other stakeholders in Northern Baja California and Southern California will allow us to continue to improve transportation infrastructure, enhance economic competitiveness, and work towards a more sustainable environment for the region. And I want to thank all of you for prioritizing the issues of equitable investment and make sure that the people who need our help the most at this time receive the most help. Thank you so much for the opportunity to testify before you this morning. And again, to thank all of our colleagues along the border region for their inspiring and courageous efforts to make a difference when we needed them the most. I would be happy to answer any questions you may have. Thank you.
Thank you, Mr. Mayor, and I appreciate your very, very hard work on behalf of not only the people of Imperial Beach, but of the entire state with all your work. Thank you very much. We're going to go to Kate Clark now, the Senior Director of Immigration Services with the Jewish Family Service Center.
Thank you. Good morning. My name is Kate Clark. I am the Senior Director of Immigration Services and Lead Immigration Attorney at Jewish Family Service of San Diego. I am grateful for the opportunity to share how JFS, a large nonprofit service provider in the borderlands, has responded to serve the community during the COVID-19 pandemic. Jewish Family Service is a client-centered, impact-driven organization working to build a stronger, healthier, more resilient San Diego. For many in San Diego, making ends meet is a daily challenge. This is specifically true for our community's most vulnerable, unemployed and underemployed individuals and parents with children at home, older adults, people experiencing homelessness, undocumented immigrants, and asylum seekers, to name a few. Today, I will focus my testimony just on a few areas of JFS's service delivery programs to respond to an increased need during this COVID-19 pandemic. No-touch drive-through distributions for food. The JFS no-touch food distributions are open every day to meet San Diego's critical food needs. Since this pandemic began, on average, more than 9,100 drive-through meals have been provided through this distribution every single week. This equates to over 118,648 drive-through meals distributed since COVID-19 began. Senior support. COVID-19 has significantly impacted older adults with the risk of increased infection, but also the health risks associated with social isolation. Our on-site kitchen has prepared more than quadruple the number of productive meals pre-COVID, going from 1 shift to 2 shifts where we make more than 1,600 meals per day. In total, from March 16th to June 21st, our team of volunteer drivers have delivered upwards of 341,216 freshly cooked and shelf-stable meals to older adults in their homes. Safe parking. Already widely used pre-pandemic, Jewish Family Services' 3 safe parking program lots offer a safe place overnight for people who live in their vehicles. In response to COVID-19, we've expanded our hours of operation, including to 24/7 at 2 lots, and 1 lot moved to a larger location to hold more vehicles. With an average of 251 participants each night, the Safe Parking Program has provided critical resources, including 3 meals per day to families, individuals, and people with young children. Disaster relief assistance for immigrants. JFS is the state of California's partner to distribute its disaster relief assistance for immigrants, or DRY program, in San Diego and Imperial counties. Undocumented individuals are disproportionately impacted by today's health crisis, as they are ineligible for federal stimulus dollars via the CARES Act or other disaster relief funding. Through the DRY program, just yesterday, JFS completed enrolling 10,000 applicants, which equates to a total of $5 million distributed to undocumented immigrants. Daily, we fielded calls from an excess of 20,000 individuals in the borderlands trying to access these funds. Immigration detention in the borderlands. JFS is one of a handful of nonprofit immigration legal service providers in the region providing pro bono representation to detained immigrants. There are 2 detention centers, the Otay Mesa Detention Center and the Imperial Regional Detention Facility, and both are operated by for-profit corporations. This presents a unique challenge to the state of California within the context of COVID-19 and public health. Currently, the Otay Mesa Detention Center is the site of one of the largest outbreaks of COVID-19 in the entire country, with more than 160 individuals having tested positive for COVID-19. Individuals detained at the Otay Mesa Detention Center were coerced to sign legal waivers as the only way to obtain PPE. Indeed, the operation of both of these facilities by for-profit operators raises serious questions as to how decisions involving public safety are being carried out. Respite migrant shelter in the borderlands. The critical importance of a respite migrant shelter to the protection of public health is vitally important. JFS operates San Diego's Migrant Family Shelter, and we have assisted more than 23,000 individuals since October of 2018, and this includes 11,500 children. Our job was to ensure our shelter guests were healthy and able to travel to their final destination. Today, with the border effectively closed, the number of asylum-seeking families we are assisting has dramatically increased, though we have reason to believe that these numbers will again increase once the San Diego Immigration Court resumes hearings in mid-July for individuals enrolled into the Remain in Mexico program. Again, it will be through a coordinated effort by JFS and others, in addition to government partners, including the state of California and San Diego County, who will be critical in meeting the unique needs presented in our region. JFS understands that the state is facing an unprecedented fiscal crisis, not brought on by an economic recession, but by a pandemic that has brought the world to a halt. And we continue to see how COVID-19 has hit vulnerable population the hardest, those with weakened immune systems, seniors, people of color, and others. The story of how successful we will prevail over this virus will be measured by how well we care for people that are most at risk in our state. And in this moment, JFS respectfully asks for the state to continue investment for immigration legal services, in addition to accountability and oversight over the detention conditions for the two detention facilities in our region, though there are others in the state of California. Continued investment to maintain the infrastructure of the respite shelter operated by JFS for asylum seekers released from the Department of Homeland Security to ensure the protection of public health. Continued investment for the direct financial assistance for undocumented immigrants who are otherwise ineligible to receive federal stimulus dollars via the CARES Act. At JFS, our call to action is moving forward together. This is what we intend to do through this crisis and beyond. And again, I thank you for the opportunity to share our day-to-day and the challenges we seek to respond to and find solutions for as the situation continues to evolve.
Thank you very much. What a great presentation, and thank you for all your work on behalf of the people of our community. Senator Rubio, did you have a question?
Yes, this question is for Kate Clark. First of all, Kate, thank you so much for your services. I've been one of the privileged ones to take a tour with you, not only in the Jewish Center, but also the Otay Mesa Detention Center. I just want a little bit more of an expansion on the individuals that were coerced to sign waivers. If you can expand on that, what has been the outcome of those that were coerced, and where did they end up based on those coercions?
Sure. We had received that information directly from our clients over the past couple of months. Really, it's clear to me that the information that's being shared with individuals who are being detained, specifically at the Otay Mesa Detention Center, is really out of a vacuum. There's not really any structure or system in place to ensure that the detained individuals have their safety and wellness being cared for, or their best interests are being looked after. Of course, the ACLU of San Diego and Imperial counties have since challenged and brought suit against Immigration Customs Enforcement for the conditions that are at the Otay Mesa Detention Facility. But we continue to receive horrific reports from our clients and others who are seeking legal services and who are, of course, interested in getting out of the detention center as soon as possible. It's really unfortunate that the United States has taken the approach to civilly detain immigrants. There's really no reason to do that, especially for asylum seekers that are seeking protection and fleeing for violence and persecution from their home country. but JFS and others continue to receive these calls every day and do our best to, represent folks in bond hearings and parole them out of the facility given the egregious and horrific conditions of the facility at Otay Mesa.
Thank you. And I have one more question, if I may. Earlier I had asked, because I had heard about the 160 cases in the detention centers, but I wanted to talk about the information that was released. I believe the federal government is going to allow, I think, over 100 children to be released, and there was confusion as to whether or not they were going to be released with their parents or alone. Do you have information on what's happening to those that are going to be released?
Yes, yeah. My understanding is that that largely applies to family detention centers. Fortunately, there are no family detention centers in California, but that really underscores the importance of the investment, the state's continued investment into the San Diego Respite Shelter for Migrant Families. Because there is no family detention center, individuals, family units specifically, are able to be released on the Alternatives to Detention program so that they are not detained at family detention centers across the United States in order to get to their final destination. So while we do not have to specifically deal with families being detained in our region or our state, it is something that other states are grappling with because there are family detention centers there, namely in Texas and Pennsylvania.
Thank you. One more question, if I know we're running late, is that okay? Chair, I don't know our time.
We're being asked to recess by the pro tem.
Oh, okay.
So unfortunately, we're going to have to recess our hearing and come back as soon as we're done with our caucus meeting, unfortunately. So
thank you.
We're going to take a brief recess, and I believe we'll be back in about approximately 20 minutes, and we'll resume our hearing. For the people that are waiting online, I apologize. We've gone over on time, and we also have one presenter, Luis Olmedo, that's waiting also to present, and we'll try to reconnect with everybody when we return. So I want to apologize for that, but unfortunately, we had another scheduled hearing that we all must attend. So we're going to schedule for about 20 minutes and return. With the Special Committee in the Pandemic Emergency Response and the California-Mexico Cooperation Select Committee are going to resume our hearing. I want to begin by apologizing to those individuals that were set in the queue to speak, and for the members of the public for interrupting our meeting. We had a very important session to go into. I'm very sorry about that. We did go over on our allotted time through our presentations and our speakers, so that created a problem for us, and we had a recess, and I want to apologize to all the members of the community for that recess. But we are back, and we will resume our hearing in about 60 seconds approximately. We're sending messages out to the people that we know that were on the call to get them tuned in once again for those that want to speak. And we are reaching out to our presenter as well. So in about 60 seconds, we will resume, ladies and gentlemen. Thank you very much for supporting us in this, and we're very, very sorry we had a recess. But once again, this is the joint hearing with the Special Committee on the Pandemic Emergency Response and the Select Committee on California-Mexico Cooperation. Thank you very much. Ladies and gentlemen, we will resume our hearing. For all individuals wishing to provide public comment following our next presenter, we will have public comment. And for all of those that are tuned in and wish to provide public comment, I will provide the participant toll-free number and access code at the appropriate time. And it's on the committee's website right now. If you have access to that, that's the appropriate information. When we move to the public comment, a moderator will identify you individually, open your line, and at that time you may address the committee. It is important that we hear from you and that we thank you for your patience. Again, I want to apologize for interrupting our hearing, but we will resume now and hear from our final presenter. Our final presenter is Luis Olmedo, the Executive Director of Comité Cívico del Valle, an organization that's been on the forefront of providing access to different programs for the underserved community. Again, this is under our heading of the vulnerable populations, the economic and public health impacts of the COVID-19. And as we know, there has been a disparate impact on underserved communities. And individuals like Mr. Luis Olmedo are at the tip of the spear providing services to members of our underserved communities. So it is at this time that they have been working hardest to provide those resources. And we want to thank individuals like Luis Olmedo who have been out there providing these services, food services, access to information about health care, access to vital services and information that are helping the most underserved survive in our state. So if Mr. Olmedo is on the line, we'd like to open up the mic and let him now begin his presentation. Mr. Olmedo, thank you very much for joining us. It's a pleasure to have you. And I know so many things are going on in Imperial County. We really wish the people the best out there, the victims of COVID, the families, the victims of the fire in Nyland. Our hearts go out to those families. I know that they are in dire need of assistance and help. Many of them now are families that are now homeless. So lots of things happening. And of course, I thank you for your service to our state and the people of your beautiful county. Thank you again for what you do and joining us today. This is must be a difficult time, but thank you for taking time from your day. Welcome.
Thank you, Chairman Senator Benueso. You know, the sentiments are reciprocal, and if there was ever a time that we could forecast this worst-case scenario and we could choose our leader, we definitely would make sure that leaders like yourself would be at the helm representing us in the state of California, as well as Assemblymember Eduardo Garcia. We could not be in better hands. And thank you to the members of the committee who have also made time to listen to our border communities that have often been left behind historically. You know, in the recess, I mean, I did submit some formal comments, but I don't want to focus on those formal comments. I want to bring back sort of the bigger picture, the situation that's happening here in the Imperial Valley for decades. I know I've been around for 20 years, and we have been pounding on the door of the legislature to recognize the fact that we are an interconnected community with Mexico. We have a fluid relationship where there is a convenience of essential workers working our essential jobs, our agriculture, our manufacturing, our retail, our wholesale. We are an entire community here, and California has not recognize that, and whether it be through legislation, whether it be through health efforts, it has not recognized that. And these are the worst possible conditions that we can be in right now. We need to change that. When we talk about underlying conditions, we cannot just fight the battle at the front lines when the patients have already reached the worst possible scenario, which is emergency care. We need to also be proactive. If we are not proactive, we will never end. I mean, when was the last time we were able to eradicate an ant nest by eradicating one ant at a time? And this is a prime breeding ground for COVID. All the inequities that exist here, we have a Salton Sea, we have the New River, which is a breeding ground for these types of viral conditions that have existed here. If we don't look at the bigger picture, if we're just taking care of the emergency, we're only going to continue to care for the most critically ill, and we're not going to be able to go back and be able to stop this crisis in time before it has some significant damage in our communities. We definitely need, and I reciprocate everything our leaders in healthcare have been saying. We need, personal protective equipment, PPE. We need to protect our voters. We sent letters, I believe, about four months ago to our congressmen, and we're still waiting for a meeting. But these are things that has brought together our communities, even among non-traditional partnerships, such as the Farm Bureau, who stepped in and said, we recognize that border, and we recognize the farm workers and the essential workers that are unprotected, and we need the federal government to step in. I've been around long enough to see federal government being very responsive, and I've seen the federal government when they pack up and leave. But you know what? We could not be in better hands in California with a governor that has been responsive, but we need to give them the entire account, and we need the legislature to see the whole picture. And the whole picture is that we're dealing with these inequities and these pre-existing conditions that are putting our entire population, and we're seeing the results. The results of the spike in the conditions is not to just point at the victim, because everybody is a victim. Everybody who lives here, whether you have COVID or whether you're higher risk of COVID, is you're being put in these conditions that have not been addressed for a very long time. So what we need right now, I've also have the privilege to work with many of the bureaucracies had a long history working with CDPH, and I certainly congratulate the new director in her appointment this last Friday. But the State Department of Public Health has an Office of Equity, and this is work that the legislature did. We want that promise of that equity in investment in our community and eradicating all these pre-existing conditions. All these social determinants of health, the barriers that exist there. It's not enough to just have a two-way communication between emergency care and being reactive. We have a lot of nonprofits here in the Imperial Valley that have been here, that have been filling the gaps of service for decades upon decades. My organization has been here for 30 years, nearly 35 years. We have organizations here that have been here much longer, and I have not seen the state of California step up and say, let's pull in all those organizations that are there providing healthcare, providing social services, food services, many services that we need, so that we can also take this strategy and be proactive in our communities and making sure we're reaching the harder reach. I have seen this strategy too many times where the state bureaucracy just looks as far as their eyes can see. And then they focus in these statewide strategies and these regional strategies. And we certainly are in solidarity with our brothers and sisters in San Diego, in San Isidro. But we need the state to engage our local nonprofits. We've been having many conversations here in the county, and I'm very pleased that some of the county leaders are really stepping up and recognizing and embracing the fact that our own policies have been written over 100 years ago. These are pioneer policies that were helpful to elevate and create the type of economy that exists here. But we've forgotten about the over 85% Latinos, and if we are successful in getting a complete count, it could easily be over 90% Latinos. And by the way, COVID is having its greatest damage on communities of color, Latinos, communities, and this is the prime breeding ground for COVID to thrive. So again, what is the things that we need? We need the state of California to not only just coordinate at the county level, we need to engage all the nonprofits that have the capacity to go out and retool. For years, these organizations that are there, that have been the safety net organizations, have been cut year after year after year. We need to put resources in their hands so that we can reach the population that some have chosen to say it's their fault. It's because they don't wear their mask. It's because they're not listening. Let me tell you about the farm workers. They have to build this type of resistance and say, because of the working conditions, because of the exposures that they face, do you think that they're scared of a virus? They don't. They have been conditioned to deal with very harsh conditions. So when we go out and talk to the community and the farm workers, They feel that this is just another call that's going to pass them by. And that's not a failure of theirs. That's a failure of the conditions that they have been put to. And the fact that the state of California benefits from these essential workers, yet is not providing them the resources they need. What we need to do is take a step back, continue to fund our hospitals. And by the way, I want to say Larry Lewis, I want to congratulate him because he is a leader that is not afraid of bringing nonprofits into his space. And we actually have formal agreements working in his hospital, and we need more of that, as well as the County of Imperial bringing nonprofits into their space. I congratulate him for that. These top-down models are not going to work here. So we need to be able to bring all nonprofits, retool them, refund them, and get them out in the community so that we can work together. And this is a message to the leaders of these agencies. You need to get your team, the bureaucrats, the bureaucracy, to connect to our organizations, to connect to our communities. We know this very well. We know the conditions we live in. We know where the problems are. Okay. So we need to tackle this situation from both emergency care, provide them all the resources they need, and let's get out in the neighborhoods and the communities and reach the hard reach and eradicate these inequities that have existed and have plagued our communities for a very long time. Thank you, Senator. I'm available for any questions. I have submitted comments, and I want to recognize the many advocates that have been born and coalitions that were born out of this crisis here. La Coalición de la Buena Salud y Bienestar Comunitario, Imperial Valley Community Health Coalition, as well as the Equity and Justice Coalition and many other nonprofits that are working here locally. We want to be part of the solution, engage us, and thank you, Senator, for your leadership. Thank you to the committee for your leadership. And I echo everything that has already been said. All the experts at the table, they shared the data, they shared the conditions, but we need an opportunity to engage us meaningfully in the strategy. Thank you.
Well, we really appreciate you joining us to articulate the special circumstances under which the border communities exist, and no one knows better than somebody who's been serving a border community at the grassroots level. So we appreciate you weighing in, and I think it's an important message that we want to send to the leadership here, not only of the Senate, of the Assembly, and of the Governor's Office and all the departments, that there are very unique circumstances that we're dealing with at the border that are causing rise to these incidents at alarming rates, and that is because there's just such an amazing integration of the border communities. Mexico and California are intertwined in so many complex ways. Imperial County is the salad bowl of California, and they produce just an enormous amount of important ingredients that we all consume as consumers. And we need Imperial County, and what's happening there is very dangerous to all California's public health, especially if it interrupts the production of many important food sources for our state. So thank you for that. I wanted to ask Senator Gonzalez, did you want to make any comments or questions or anything in particular?
Thank you, Senator Wessel, and thank you to all the panelists as well. This has been a very, very good hearing on this very important topic. And so I just want to reiterate a few things that have been mentioned before, but the progress on specific resources, I think a couple of the panelists mentioned specifically what they need. And I hope in our follow-up together jointly that we can provide a memo that really provides this information to bubble it up to both houses in addition to the governor's office to ensure that we get those needs met in a timely manner. I will also reiterate the ICE detention centers and federal detention centers, and although that is outside of our purview, I know that many of these community members either are being transferred by ICE, which they're getting into, they're immigrant community members going into these facilities that have large positive cases, which is not in many of our thoughts, not a good space for them to continue living in. So at some point, we're going to have to address that with our federal partners and work very closely together with them. But lastly, I just wanted to ask about the testing capacity, because I know that had been lightly touched. And although right now I think the state is maybe at 100,000 tests per day, given the spikes in various areas, I'm wondering if there's any data in the Imperial, San Diego County area related to asymptomatic people, because we don't hear enough about asymptomatic, especially the younger populations that are just spreading the virus. So if there is anyone on the panel that can answer that, that would be really helpful. And then lastly, I will say in our first hearing for the pandemic emergency response, we connected with Dr. Steve Gonius from UCSD, and I'd be happy to ensure that Senator Wessel's office has his information, because he has focused on testing and tracing and asymptomatic data as well. So I'll leave it there. Thank you.
Well, we have Mr. Olmedo. Are you privy to any of the information she referenced considering the test rates in Imperial County?
Yeah, I don't have the test details. I know that the health director provided a detail of what they're doing. What I do have is, I definitely agree. We only have limited test sites. I want to recognize the fact that several months ago, local private doctors were the first to go out and do these drive-through clinics. They did not have the PPE on hand, and we made sure that we worked with OES, which then referred us to the State Department of Public Health, which then communicated to the Imperial County Public Health. See, that's why it's important that we have a much broader strategy so that we are not missing opportunities. So we actually have been doing tests for quite a few months before the state and before the county got retooled themselves to go out and do their initial testing. Even though we have more tests, but we need a lot more tests here locally. Let's go back to what I've mentioned. We still have barriers in transportation. We still have barriers in getting the information out to people not getting the information through social media. We need to go out there door to door and be able to reach, and social distancing strategies and many different strategies to reach the hard to reach population. So it's a joint strategy that we need, not only to have more testing sites, because you can have many testing sites, but if you don't have transportation, you're not going to get the families to be able to get there. And if they don't have the information, they won't be able to know when these tests are happening. We mentioned earlier the recent fire. We actually have this situation happening right now where a fire happened about 5 to 10 miles away from the emergency center, and we've identified that along with the counties. Actually, the county identified that there's transportation issues, so now we're trying to solve that to where the county's checking with our local transportation department to try to provide that transportation. But that is exact scenarios that we're dealing with right here. So yes, we need more testing, we need more supplies, we need more hospital beds, we need more medical care, but we also need to retool. And I'm glad I had another opportunity because, I actually said, what are the asks? And, we need $50 million to start with. Let's get these dollars into all these nonprofits. We need the help. The county can't do it alone. We've all recognized none of us can do it alone. We need to do it together.
Okay, very well. Thank you. We have several people on the line wishing to express themselves through public comment. And there are also representatives of organizations that have been instrumental at providing support to our communities, from the Chambers of Commerce, from organizations like Casa Familiar, that's been a very integral nonprofit at the border that is providing support for families in one of San Diego's most challenged communities. And so we'll go to the phones now to listen to people from the public. So, ladies and gentlemen, if you are listening and you're not currently on the line, the participant phone number is 844-291-6364, 844-291-6344. And the participant access code is 636-4815, 636-4815. The moderator, if you'd like to open the lines and announce each caller individually, we can begin hearing from the public. Each person testified, and it's limited to 1 minute to provide their comments. So we will begin. If you can announce the caller, and I ask callers to state your name, and if you're representing an organization in particular, please let us know that as well.
Ladies and gentlemen, if you wish to queue up to give public comment, please press 1, then 0 on your telephone keypad. An operator will provide you your line number and further instruct you. If you're using a speakerphone, we ask that you please pick up the handset before pressing the numbers. We do have several that are queuing up at this time. We will start with line number 38, line 38. Your line is open.
Good afternoon. This is Zach Kalinowski with the ACLU of California. Despite the COVID-19 pandemic now raging in California's Immigrant Detention Center in California, CDCR continues to voluntarily pipeline community members into detention rather than returning them to their families and loved ones. When CDCR identified vulnerable community members for accelerated release this spring, 78% of those community were transferred to ICE detention straight from one COVID hotbed to another. Mid-June, ICE reported a 28% positive rate among individuals it tested in its custody. Testing, sanitary conditions, and access to PPE remains extremely limited months into this pandemic. A family member of a person detained at the Imperial Region Detention Facility in Calexico reported their loved one spent 30 days in solitary for raising concerns about the inability to practice social distancing inside the prison. We urge this committee to address the state's role in exacerbating this pandemic within the border community by continuing to transfer community members from state jails and prisons into immigrant detention. Thank you.
Thank you, sir. Appreciate your participation. Do we have anybody else on the line?
We certainly do. We'll go to line number 43, line 43. Your line is open.
Good afternoon. Thank you, Mr. Chair and members. This is Connie Delgado on behalf of the District Hospital Leadership Forum representing district and municipal hospitals. Senators, we appreciate this great discussion on the pandemic and its impact on the communities near the California-Mexico border. And we hope to continue discussions with you and other members on how we can help our district hospitals weather this pandemic. And we thank you again.
Thank you, and we'll go to the next speaker now.
Our next caller is from line number 33, line 33. Your line is open.
Hello, my name is Mindy Pressman, and I'm an organizer with Otay Mesa Detention Resistance, and I'd like to comment on the question about coercion of people detained at Otay. In April, we received calls from people detained at Otay saying they were told they would receive a face mask, but only if they signed a liability waiver. And someone inside read us the waiver over the phone, and it indeed included language about holding CoreCivic harmless. We then took masks to Otay with Assemblywoman Lorena Gonzalez, and our donation was refused. CoreCivic is a for-profit company putting the people it detains and our entire community at risk. The state must hold private prison operators accountable for the abuses they have caused, which include death. And so far, Governor Newsom has refused to use his authority to do so. We need California to protect all Californians, which means holding these companies accountable, halting transfers from state custody to for-profit immigration facilities, and halting expansion of these facilities. Thank you.
Thank you. We'll go on to the next caller.
Our next caller is from line number 42, line 4. Your line is open.
Good afternoon. This is Christy Sepulveda Berksit. And question has to do, or actually, I just had questions as far as the numbers in terms of how many people are coming over from Mexico, either by helicopter, medical transport, or whatnot, to our hospitals, and then do those numbers count against the counties in terms of their numbers? I know that's not a question you guys necessarily can answer today, but I'm hoping that this committee can get that kind of information out to the citizens of California, because that's information we would like to know. Thank you.
Thank you. And we're going to follow up, just to respond, we're going to follow up to try to get that information. So if you want to communicate with my office we could probably assist in getting that information for you. Thank you for calling. Do we have the next caller?
Yes, next caller will come from line number 3232. Your line is open.
Good afternoon. John Hernandez, Valley, California. My question is, where's FEMA and the federal reps in this conversation? Well, the efforts by, the Cal OES, DPH, Office of National Border Health are commendable, and the efforts by the hardworking staff in the counties and the medical facilities these combined efforts aren't working in the border to curb this pandemic. Clearly, the missing component in my eyes is the federal government. You know, these border backups are going both directions. The emergency situation, the essential workers' concerns about the workplace safety requires that there be some oversight at the federal level from OSHA and also from other agencies that need to step up. So they need to be in the conversation. You know, they're going to commemorate the Mexico-U.S. border trade agreement here come tomorrow. But over here, all the while, you know, they're talking about in the federal level walls and cages. And we are here in this border region just looking at this pandemic as it rages. So thank you very much, and invite Vargas and Harris to the party. Just have them bring their masks and safe distance and have this tested. Thank you.
Thank you for your comments. I appreciate your comments. Next caller.
Next caller is from line 40. Line 40, your line is open.
Hi, my name is Hamid Yazdan. I'm calling on behalf of Immigrant Defense Advocates. As Kate Clark mentioned, we now have COVID outbreaks at 2 detention facilities at the border. One of these outbreaks is one of the largest in the nation. And I think it's worth emphasizing that once these facilities are overrun by COVID, they'll quickly overwhelm the local hospitals and endanger the lives of thousands of residents in the community. So they represent a serious public health risk. I also wanted to just comment on the comment that was made by Senator Gonzalez saying that these facilities are not within our purview. If you actually take into consideration the fact that these facilities are run by for-profit contractors who routinely violate the terms of their contracts, the reality is once they are outside of the terms of their contracts, they are subject to state regulations. In addition to that, California actually does have the explicit authority to regulate and inspect the conditions inside these facilities explicitly under AB 103. The Attorney General has the right to inspect these facilities. So I think it's really important to emphasize that in addition to what's in their contracts, these private operators are actually mandated by ICE to develop medical plans that are coordinated with local public health officials. And that's something they have not been doing until now. So once again, if we're going to secure the state, if we're going to deal with COVID-19, there has to be a plan in place in which we do regulate these facilities and the for-profit corporations that are running them. And when they violate California laws, there has to be consequences. Thank you.
Thank you, sir. We have a speaker here in the gallery. Please state your name and...
Say my name?
Please, yeah, state your name.
Oh, thank you. I guess this plexiglass is protecting me from something very scary and dangerous. So thank you for that, even though this room appears to be empty. My name is Andrea Hedstrom, and I have no affiliation other than I'm a concerned person here in California. And I'm standing here because it is my opinion that each legislator here in California needs to do their own research. And that doesn't mean mainstream media. It means that the public health officials have been bought, and we know this. And if you want the trust of the public, you all have a responsibility to do your own analysis. Not mainstream media. For instance, the Hoover Institute study says that there's 3 times more life years lost from the lockdown measures than from COVID. From deaths of despair, delayed medical procedures, teen suicide. We're measuring these things, not mainstream media. You all have a responsibility to do your own research. You have a responsibility to the public. More cases does not mean more deaths. You work for us. We, the public, expect you to uphold your end of the bargain. Is that my timer?
Yeah, you're 30
Oh, you're
seconds
lovely,
over your
Ben
time.
Way, so thank you.
Thank you for
I'm
speaking.
sorry to leave the building and come back and have my temperature checked and have my civil rights violated, but I'm happy you let me in behind this plexiglass, because
Okay.
clearly it's keeping me safe.
I hope it does.
Have a nice
Thank you.
recess.
You too, ma'am. Next, if we could get to the next speaker on the line.
Our next speaker will come from line number 44, line 44. Your line is open.
Hi, good afternoon. Jackie Gonzalez with Immigrant Defense Advocates. With respect to the issue of coercion that Senator Rubio raised, I want to begin by just echoing that these facilities are immigration detention facilities, but they're actually operated by private operators, as some of my colleagues in public comment have raised. And the private corporations have systematically and routinely engaged in perpetuating horrific conditions for those detained, and this is an issue that's been ongoing, but obviously exacerbated with COVID-19. And there are very clear guidelines that these corporations are supposed to follow to protect minimum standards for health and safety. And when they violate them using violence and coercion, as Ms. Clark testified to earlier in this presentation, there's absolutely no accountability for that behavior. And when they do that, they're acting outside the scope of their federal contractors. So it's absolutely within our purview to regulate these corporations and seek accountability and liability. We have the right and duty to protect people in these facilities much in the same manner, for example, that we would for elderly folks detained in privately run nursing homes or in the custody of privately run nursing homes. And we don't turn a blind eye to that concentrated vulnerable population simply because of whose care they're in. So while we understand that combating this virus takes a collective effort, we believe it's repugnant to leave these members of our population behind. It's also against our self-interest. We know that the spread of COVID-19 at Otay Mesa affects the border right now, but like so many issues that begin at the border, they have larger implications for our state. So I want to thank especially Senator Gonzalez and Senator Hueso for holding this joint hearing and for their dedicated staff to organizing our attention on this issue. Thank you.
Thank you. Do we have another speaker on the line?
Yes, we'll go to line number 34, line 34. Your line is open.
Can you hear me?
Line number, we can hear you now. Go ahead.
Okay, hi. My name is Joe Riley, and I'm an advocate for IHSS, and I want to say that in fairness,
You're fading out of the call. We heard you loud, and you started fading out. Now we can't hear you. So.
Okay, can you hear me better now?
Yep, you sound nice now.
Oh, okay, sorry. I'm Joe Riley, and I am saying that there's 50,000 vulnerable people, elderly and disabled people, that are on IHSS in-home supportive services, and then there's another 50,000 workers who take care of them. And these workers go from Mexico to the United States, and regularly, some of them. And we need to have like a pilot program that will test San Diego and Imperial County workers of IHSS, and they're already in with CMS, which is a federal agency, Department of Healthcare Services, and CDSS, and their local counties. So we're already in contact with all those agencies. You could easily do testing of both the recipients and the workers, which are caregivers. They're the frontline workers, and they're paid around minimum wage. Most of them don't have health care. And so if you could do a pilot program showing San Diego and Imperial, where you put in funding for PPE and testing, and what the benefits of that would be, because there's almost 600,000 vulnerable people that have disabilities on trachs and ventilators and different kinds of paramedical needs that are taken care of by the frontline workers, which are IHSS caregivers that are exploited, that do not get proper pay. They're always around minimum wage, and they're always.
If you could wrap up now, ma'am, you're over 30 seconds over your allotted time. If you could just wrap up your comments.
Okay, so I'm just hoping that you could get a pilot program concentrating on the most vulnerable, and also if you could get our children and immigrants out of cages and being detained, that would also help. Thank you.
Thank you for your comments, and thank you for participating. Do we have another caller on the line?
Yes, we'll go to line number 41, line 41. Your line is open.
Hi, can you hear me?
Yes, you're
Hello?
coming in. Yes, we can hear you.
Great, thank you. Hi, my name is Grisel Ruiz, and I'm the supervising attorney at the Immigrant Legal Resource Center. First, thank you so much for acknowledging the COVID crisis in immigration detention centers. And we'd like to highlight one critical thing that can happen right now in order to halt Californians from being funneled into these terrible facilities. To start, it's not just ICE that's transferring people to the detention centers. It is, in fact, the state. Through its cooperation at the county jail and state prison level with ICE, we are voluntarily and actively transferring people from local and state custody to these file immigration detention centers. Even before COVID, and especially during COVID, it remains a primary way that these facilities are populated. Notably, this cooperation is entirely voluntary, and it is within the state's authority and power to halt this cooperation. In fact, this has already happened in several counties in California. However, what we need is more than just select counties rising to the challenge. Similar to the shelter-at-home orders, what we really need is a wholesale stop to all transfers statewide, especially under COVID-19. And so we do urge the state to halt all of these transfers at the local and state level and stop our role in funneling people into immigration detention centers. Thank you.
Thank you. We'll go to the next speaker now.
We have actually exhausted the queue at this time. Would you like me to reprompt?
Yes, please.
Thank you. Ladies and gentlemen, once again, if you'd like to place yourself in the queue, you may press 1, then 0 at this time. And it appears we may have a couple more queuing up. Please allow a few moments for us to provide line numbers.
So if anyone is listening, we'd love to hear from you. If you want to call in, if you want to express yourself, make some comments, now is the time. Again, our number is 844-291-6364. Lines are open if you'd like to call. The participant access code is 636-4815. Ladies and gentlemen, if you would like to weigh in, please give us a call. We'd love to hear from you. Do we have anyone else?
Okay, we did have a few more that have queued up. I'm going to go to line number 47. Your line is open. Line 47, can you check your line for self-mute? We're not hearing any audio. We're not hearing any audio on that line, so I'm going to release that one. They can feel free to queue up if they so choose. We'll go to line number 50, line 50. Please go ahead.
Yes, thank you. Right now?
Yes, we can hear you.
Yes, ma'am.
Yes, my name is Margaret Baker, and I'm with South Bay People Power. In the midst of the unprecedented global COVID-19 pandemic, California is continuing to funnel immigrants who are eligible to be released from local and state custody into ICE detention facilities where the virus is spreading rapidly and unabated. These transfers to ICE not only jeopardize the lives of the immigrant community members, they also undercut the state's hard-fought efforts to flatten the curve and reduce the health risks of this highly transmissible virus for all Californians. So we are calling on the governor and our legislators in the state to suspend transfers to an expansion of immigration detention facilities. When immigrant members, including green card holders and undocumented immigrants, are eligible to be released from local jails and state prisons, rather than being released, they're being handed over to ICE or a private ICE subcontractor to be transferred into immigrant detention for detention purposes. These community members are eligible for release from local jails and prisons when they complete their sentence and receive a commutation from the governor or obtain parole granted by the Board of Parole Hearings and reviewed by the governor. So our governor has this power to end ICE transfers, and we are calling on him and our legislators to support in this effort to suspend all transfers to an expansion of immigration detention prisons. Thank you.
Thank you. Thank you for participating and for your comments. Do we have any other callers on the line?
Yes, we'll go to line number 49, line 49. Your line is open.
Hello, good afternoon. I want to thank you for, I'm a citizen, thank you for having this committee, and it's very important to me. I live in Central, one of the largest places in Imperial County. I just want to state that one of the biggest rates of infection for traveling, as you said earlier in the committee, but also thinking that they're immune. People are going without masks, people are going in places, parties that are more than 10 people and sitting close together. Just my neighborhood in El Centro, I've seen people having many parties, especially with the holidays and birthdays. And I think there's going to be a major big infection rate on the 4th of July. I think that there needs to be an enforcement of curfew. I think this is, unless if we don't enforce the curfew, it's going to get even worse. And that is what I want to state. Thank you for your time.
Thank you for sharing your comments. Thank you for participating. Do we have anyone else on the line?
I have one more currently in queue. That's line number 47, line 47. Your line is open.
Thank you very much. My name is Paola Avila. I represent the San Diego Regional Chamber of Commerce. Thank you for the opportunity to provide comments today. As mentioned by many of the speakers, the pandemic has highlighted our cross-border interdependency, which requires a high level of coordination to overcome the challenges we face. There are several factors which have adversely impacted our communities, and I've outlined them in written testimony, which I submitted. But in the interest of time here, I'll just mention one in particular, and that's the travel restrictions which were implemented at the border and remain in place. This led to reduced hours of operation and lanes at several ports of entry. However, and it was mentioned by Mayor Dedina that in the Sandag study that there was reduced vehicle traffic that prompted this reduced operations. However, this led to increased border wait times, and we know that border wait times contribute to air pollution, endangering public health in border communities, and that's one of the underlying causes for higher risk for developing complications from COVID illness. Restoring staffing levels, operation at the border, but also advancing the construction of the Otay Mesa East Land Port of Entry, a project led by the state of California, are both critical at this time to reduce these impacts, and also as we look towards economic recovery. Neither side of our border can succeed if the other fails. I really appreciate this opportunity to speak and for you hosting this important hearing.
And I really want to thank you for joining us and for weighing in and giving us your comments. Appreciate it very much, and keep up the great work with the Chamber. Do we have anybody else on the line?
We do have one more that just late queued up. We'll go to line number 51, line 51. Your line is open.
Hi, good afternoon, Chair and members. This is Adriana Sanchez Ochoa with Next Gen Policy. I wanted to first thank you for your leadership in addressing the importance of this issue, both as it relates to what's happening on the border and what is happening in our detention centers. Next Gen Policy has been working extremely hard to get this issue in front of the legislature. So again, thank you. We've also been working very hard with the governor and bringing this up as the crisis that it is. To answer and to maybe reiterate what was asked by Senator Gonzalez, whether or not we have federal jurisdiction, and I know some of our other nonprofit folks that were on the line commented on this. Next Gen is supporting a bill that actually would address some of these issues, which is AB 3228. So I wanted to share that and reiterate our commitment to this issue, and if in any way we can continue to be helpful to bring this to light and to get to solutions that are actually tangible so that these communities that are always looked upon as being non-essential, not important, we can bring this up to the forefront. We are in the fight and ready to go. So again, Senator Wetzel and Senator Gonzalez, we thank you for your leadership, and I look forward to working with both your staff and continuing to bring this issue to light. Thank you.
Thank you, and I appreciate all your hard work and all your wonderful work representing the people in these facilities that really need the light shined on the practices that are going on there. So thank you very much for your participation in today's hearing as well. Anyone else? Do we have anyone else on the line?
We have once again exhausted the queue at this time.
Okay, and we're going to ask people, if any other public comment, to please call in at this time. Once again, the number is 844-291-6364. The participant access code is 636-4815. This is your opportunity to weigh in on this important issue. While people are queuing in, I want to just make a few comments to some of the callers that called in. There were some questions asked, and if I can get the information, I feel it's my responsibility to provide it in terms of what we have. Somebody asked about the number of tests in San Diego County. From what we have been able to gather, first of all, San Diego County does not require symptoms to get a test. So anyone that wants a test could go to any of the testing facilities and get a test. And we encourage people, if they have an opportunity to do so, to do that, so we can get to get an accurate count. Also, make sure that people are quarantining if they need to be. There's a 7-day rolling average in San Diego County of tests performed. That is the number I'm giving is a very specific number, 7,082, but I imagine it's just slightly above 7,000 per week of the tests that are actually being conducted in San Diego County. If I'm not correct, if I'm not mistaken, I mean. Okay, so is that an accurate number? Okay, it is an accurate number. Also, regarding the transfers, we have an assembly member taking the lead on ending the transfer issue, and I'm a big supporter of that. I signed on to the letter, and hopefully those transfers, it is within the power of California to exercise our authority to limit those transfers or end them, and I'm a proponent of that, and hopefully that would happen in our state soon, to help protect not only the health and safety of those involved, but of the people that handle that population as well. Very important issue. Do we have anyone else calling in? Do we have any other callers in the queue?
There is no one else in the queue at this time.
Okay, well, we're going to wrap up our session. I want to thank all of you for participating, for members of the public for calling in, for those that also came in person. I want to thank you for your participation. Your comments are very important to us. We also want to thank the members. A special thanks to Senator Gonzalez for her joining us with her select committee, and to the members of the public for making time to attend this hearing. Special appreciation for the speakers and guests who traveled to be here, and those that took time from the day to help us inform the public as best we can. We're doing our best here in California, and we're very concerned about everything that's happening related to this issue and the impact it's having one way or another. As you can see, there are no matter what we do, there are victims on both sides, and this is just a very terrible, terrible time that we're all living through. And I think if we all work together and join together, we'll get through it together and win the fight over this pandemic. Everyone stay safe. We wish you a very happy day. And for all of those celebrating the 4th of July, this is a time to celebrate the birthday of our nation, a very proud time. But we also ask people to exercise caution and to be very careful, and to please observe social distancing and all the recommendations of our public health officials. Thank you very much, and have a wonderful day and a wonderful holiday coming up.